So do we want to go ahead and start?
Whenever you're ready.
Okay, well, we're at about 90, so you know what they say, you snooze, you lose. So, okay, it's all yours.
All right. Thank you so much for having me, Debbie. So my name's Dr. Kelly Everson. This is my first Zoom presentation, as I'm sure is most of ours and being on things. So I present often on this topic, but never in this format. So I'm going to do my very best to not have technical difficulties, and I do have the Zoom, the chat open. I'm going to do my best as I go to kind of watch for questions. Typically when I present, I tell people to, to ask a question right away. We learn better together, as we go. So if you have a question and you want me to elaborate on something, pop it up there. I'm going to do my best to watch that as I go a little bit, and to kind of keep an eye on my time as well. So we'll all do our best together. So what are we talking about today though? Let me see, make sure oh, there we go. So the objectives that we're talking about today. We are going to talk about, just in general, what is autism spectrum disorder? That's what Debbie asked me to kind of start the day talking about, was just laying the foundation. And so each of your next presenters will highlight more specific areas and things about autism spectrum disorder. So mine's a little bit more general to give you some background. We're going to talk a little bit about autism spectrum disorder and how that differs from a few other disorders, because that's really important. And there are a lot of kiddos that are diagnosed with multiple. There are some kiddos that are diagnosed just with other mental health conditions, and may mimic some of the characteristics of autism spectrum. So we'll take a look at that. And then just in general, how this affects the daily lives of the people that were, that either are in our loved ones in our life, or that we're working with, or in whatever fashion that we surround them with. So there we go. Humans are a social species. So I kept this in, and I think it's particularly fitting for what's going on right now. So this is, when I start this presentation, I like to talk about, what is autism, and really understanding at a core, what are kiddos who are on the spectrum are experiencing in the daily world. The first part of it is that humans are a social species in general. So by that, I mean, in general, we live together in groups. We play together, maybe not so much right at this very minute, but we play together. We work together in groups. We learn together in schools and in educational settings. And in general, as a human species, we stay together in groups. This is a really interesting concept for right now because of what's going on in our world, and how things have changed so drastically. As we go through the presentation, and probably throughout your day, you'll hear some experiences of people who are struggling, are really struggling. And so, when I give this presentation to start with, I say, sometimes our kids or adolescents and our young adults on the spectrum struggle with this, because the social difficulty is kind of at the crux a lot of times of autism spectrum. And some of us may have thought what's going on right now in our world would be ideal for certain people, on the autism spectrum. And we're finding that it's not, for the vast majority of them. Of all the clients I probably have 2 or 3 of them that are perfectly content and are, loving their time, and they're, they say to me, I don't have to talk to anybody anymore. This is great. The vast majority of them are actually realizing what they're missing, and they're feeling, I didn't enjoy going to school with people, but I don't enjoy not going to school with people either. And they're realizing the concept of the social difficulty that they were really missing. So I think this slide is fitting in both times, before and now. But in general, this is the crux of why things can be so difficult, and in across environments for our kiddos, especially diagnosed on the autism spectrum, because they have difficulty with social interaction, and it's in every experience and situation that we have everywhere. And so when you find this confusing or difficult, the world is a very difficult, confusing, anxiety-ridden place. To go a little bit more specifically though, what I would, what our main topic would be is social emotional learning. So what does that mean? That is the language of relationship. So most of us take for granted that when we walk into a room, we, without even being aware of it, we read the room. So you walk in, you open a door, and for a split 2 seconds, even if that's what it is, you read the room. We see what's the volume of the room, what's the general mood, you know, are people really excited? Is it really quiet? Are people glum? Are they angry? Is there a situation happening? Most of us walk into the room and see that pretty quickly. We're able to notice. That's called social emotional learning. That's the ability to interpret and reason this social information, the emotional information about a situation. Emotions give us meaning in general. So here's some other examples of things in terms of that. So you might walk into a room and you see somebody's facial expression and you see, oh, they're really angry. I need to approach this differently. But there's a ton of other ones. You know, there's things like double meanings, right? The all important sarcasm. You know, we all know people that talk in 90% sarcasm, right? Everything out of their mouth is sarcastic. Well, if I took everything that came out of my mouth or anybody else's mouth at their word, first of all, I'm going to be really frustrated and angry at people a lot of the time, because if I take it very, very black and white, I'm going to think that they're serious, and when they're not, and I'm going to fall into a lot of traps of what they're saying, and I'm not going to understand what's going on. The real problem with this is that as kids get older and become teenagers especially, sarcasm and double meanings and jokes become a large portion of their communication. And that gets even harder, because then people are, you know, people literally will be like, whatever, and they're saying all these things. And if you take them all at their word, you know, you're spending a lot of time really upset, really sad, feeling left out as well. You also are probably not using it yourself. So I'm also not communicating in sarcasm at all either. And I say everything as a very black and white, exactly what I mean. And that's not totally typical for different age ranges. And so these emotions that are giving our words meaning are so vitally important. And these are the things that our kids and adults on the spectrum oftentimes really struggle with. So it's things like sarcasm, jokes, like I said, anger, happiness, sadness. I would highlight guilt and embarrassment, especially, are really difficult for a lot of us in general. I mean, that doesn't always have anything to do with autism spectrum, of course, but guilt and embarrassment are really difficult emotions to try to work our way through, and they happen regularly in these situations. And so these are the things that that we struggle with. Now, if I don't notice, so say the example, if I don't notice my mom starting to get frustrated with me, and she said, Kelly, go clean your room. Kelly, go clean your room. And I'm just playing my video game. I haven't stopped yet. And I'm saying, okay. And I keep playing and I keep playing. Kelly, this is your last warning. And I keep playing, right? I'm in my own little world. I don't notice that she's gone from level 1, if we want to scale it, to a level 5. And so all of a sudden, my mom comes in the room and starts yelling at me, get off the video game, I told you, now you've lost it for the rest of the day, you know, or she's yelling whatever she's yelling. And in the perspective oftentimes of our kids and adolescents, especially on the spectrum, they don't notice these emotions building up, and all of a sudden they say, all of a sudden my mom's yelling all the time. I don't know what's going on. And sometimes there's a piece of that they just don't want to do what we want them to do. I'm not going to say that's not part of it, but oftentimes they also are just not able to understand that buildup of emotion. And so, you know, a lot of times, you know, we'll see kids that all of a sudden are, you know, like all of a sudden my mom got really mad, or this happened, and they didn't realize it was getting really out of hand. So that's that social emotional learning piece. And I spend a little time on that because I think that's the real important piece to understand as we go forward with everything else for autism. Okay, emotional regulation, or dysregulation, I think we could call it as well. the child is really unable to predict the actions and emotions of others. And so, what happens is we see kids that have really limited positive experiences with other people. I was just talking with a client last night about this. He's really struggling with how to increase his social interaction. But he's an 8th grader, and the vast majority of his social interaction has gone negatively for the most part. And so at this point, he has in his head that he really just doesn't even want to try anymore. He just doesn't think it's going to be positive. It's not going to go well. And so he thinks, why even try? This isn't going to work. What you're telling me to do is not going to work. And so they have a really limited experience of the positive piece. So then what happens is these social experiences become really anxiety provoking. They're threatening and they're worthy of avoidance. So what do we do? How do we avoid? Here's the things that we do, and I have them listed on that second part of this slide. And I think it's really important for us to understand because we see it very often in a lot of our kiddos, adolescents and adults with autism spectrum. Things like avoiding eye contact. So back in the day, we used to actually write IEP accommodations and goals for improving eye contact. Many of you might remember, if you've been involved in for a long time, you may remember we used to have very specific goals that say, so-and-so will, make eye contact 80% of the time or whatever it said. It's very rare that we do that now because now we really understand that avoiding eye contact is a coping skill and somebody is reducing their anxiety by doing that. If I sit and say, you must look at me while you're speaking to me, I've just tripled someone's anxiety if they're thinking about that. And so a common coping skill for this really is avoiding eye contact. I would highly personally recommend that you don't set specific goals for improving eye contact. My goals revolve around things like using coping skills and advocating for yourself, using words, communicating when you need to. And in every experience that I've done that, eye contact improves when anxiety goes down. And so oftentimes, I don't set specific goals for that, and it's really common. Resisting being touched, a similar thing. There's a lot of sensory input when we're being touched. So some kids and adolescents on the spectrum love to be touched, and they're sensory seeking. These are the kids that want weighted blankets, and they want heavy hugs, and they want all of that. And then we have just as many kids who are resisting being touched, and they just don't want, the closeness verbally, physically, emotionally is very vulnerable for them. And so they avoid that. Removing themselves from stressful situations. We have lots of kids who are runners. When things get really stressful, they try to remove themselves. That's oftentimes just a coping skill for releasing anxiety and getting to a safer spot. We need to be able to find them safe spots and improve their ability to cope and communicate that they're getting really stressed and they need to find somewhere safe or they need us to help them. Preoccupation with specific topics or areas of interest and these adherence to rigidity are a similar concept in this. If the world is a really stressful, scary place, but I know everything there is to know about trains, then trains are not stressful to me. And trains can reduce my anxiety. And so I learn everything there is to know about them and I become an expert and they make me feel better. And so a lot of times when we have kids who have one really specific topic or area of interest, as they get bigger, it can be video games and electronics. If they have one interest or they require that they stay on the same rigid routine. This is a similar thing. These are ways that our children are looking to reduce their anxiety. And so it's important, this is a different spin on what we sometimes hear can be sometimes the negative, parts of autism spectrum. But if we put a different spin on them, a lot of times these are just our kids and our adolescents and our adults' ways of trying to calm themselves and cope. And so oftentimes we just need to give them better tools, and they're able to decrease a lot of these things that I've just mentioned. I put a quote on here. I think it's really powerful. For those of you that are not looking at the screen and doing other stuff, I'll read it out loud. It says, and I'm just going to move my video screen so I can see it all here. Autism is a disorder that makes it hard for a person to deal with the world around them. A sound like the school bell ringing, which may not bother most kids, may sound like nails on a chalkboard to a child with autism. A tag in a t-shirt might feel like a terribly itchy sweater. The sunlight outside might feel like a flashlight that has just shined into their eyes. Autism is like walking around with your nails cut too short and your shoes on the wrong feet every single day. So I love that quote. And I think it's really a really important way to understand potentially what autism is for a lot of kiddos. I've heard other ones talk about, it's like walking through somebody who needs glasses, who lost their glasses and they're walking through a hurricane. It's this idea of there is so much stimulation coming in from the outside world that most of us take for granted, that are, we just keep moving on and say that was annoying, but we keep moving. Most of our adults and kids on the spectrum are not able to always do that. And this is the stuff that, that brings it in for them. So, as I go by, I forgot to talk to you about this beforehand, Debbie. If we have people emailing and asking for the actual presentation, or, you can always take a picture literally of the screen with your phone, but if there's things that are really pertinent to you, I can get presentations to people as well. If you need, if that's something we need, but we'll figure it out if people need the information on here. I see.
Yeah, that's perfect. I think, and I should have said this at the beginning with sort of the housekeeping issues. For those that have joined late, we will be, I know everyone who's registered, everyone who's attending, and we will send you a link to the entire presentation, or this entire recording. And then I'm sure that Kelly and Allison will provide the presentations if you'd like a copy of the presentations.
Absolutely. Good. Perfect. Okay. So what causes autism? No one knows. There are, if you look this up, which to be honest with you, don't recommend that you do. There are 8,000 or more, 8 million different theories on what causes autism. We have no idea. And the problem is that when we find one thing potentially that we think is a link, it's not a link for 80% of the other kids. So the problem is that we're finding these little tiny things that are not, it's not an end all be all. It's not for everybody. So really we do not know. Vaccines have not been shown to cause autism. In fact, the data that was originally brought up, especially against that MMR vaccine, has been debunked totally. It was not accurate data. We do not have any information that there's any link between vaccines. You'll always hear anecdotal evidence or people that say, I strongly feel after this happened, or after my child had a specifically high fever, or, whatever it is, things happen. We will never know specifically if it was that fever or if it was anything, and we just don't have the information. We have millions of studies literally across the world, some of them in our own backyard. Scripps and Max Planck are doing some amazing research as well, but there's studies across the world in terms of where autism comes from. They're looking at things like diet and maternal behavior during pregnancy. We're looking at things like trauma and other psychosocial factors. We have not found things that are a direct, link. There are many doctors out there that are looking at gut health, that are looking at diet in general of the child. Many of you have probably heard, going gluten-free or reducing, different things in the diet, taking out food coloring, all these things. I'm never one to say 100% don't try something with a child. But I also am one to say there is literally nothing out there that is an end all be all that's worked for everybody. And so a parent has to kind of make some of their own decisions in those instances, because there isn't anything out there that says that, nor are there any medications specifically, which we'll talk about, that are very specifically an end all be all that will work for everybody. There is, though, I would say, typically some genetic similarity. And by that, I mean that there oftentimes is some patterns of children who are diagnosed on the autism spectrum do oftentimes have a biological parent that may have some characteristics or that may have a diagnosis. Less likely of that oftentimes, because we are diagnosing a lot more now than we were in the past. And so it's not always that. And it is not 100%. So every child on the spectrum does not have a parent on the spectrum 100%. But you will see in many families some genetic similarity that is passed down. I will say, though, research still takes a significant amount of time on this, and this is the hardest research to do, the genetic part of it. There is one gene mutation that has been discovered that does typically account for about 10% of autism. It's so that's in general is pretty rare, and so they don't test for it automatically for anything, but there is one gene that accounts for a small portion of autism, not most of it as well. So did you know, I purposely leave this screen looking a little bit messy, because I've given this presentation for about 10 years now, off and on, and I've edited along the way, but I leave this on purpose. So just in the last, this is about 3 years worth, just in the last 3 or 4 years, this is how it's changed. Originally, I did the presentation, it said 1 in 88 children. The next time I did, the next year or two later, it was 1 in 68 children. And about a month ago, the CDC released their new data that says 1 in 54 children are being diagnosed in our country with autism spectrum disorder. Now, I could do 3 hours on potentially why that is, and how our diagnosis is getting better and earlier and more sensitive and all these things. There are lots of different theories behind why autism is on the rise, and is it truly on the rise, or are we just getting better in terms of diagnosis? And we don't know exactly. It's probably some of both, if I had to guess. But nonetheless, the new rate is 1 in 54 children. Of those children diagnosed, boys are nearly 4 times as likely than girls to have been diagnosed with autism. Now, again, on this front, we also say, boys present with many different behaviors than girls typically do. Girls overall are much more difficult to diagnose. And so are they truly 4 times less likely, or are we not diagnosing them as often? We don't know exactly, but there's part of that as well. But nonetheless, boys are much more likely to be diagnosed. We do not, as I just said, there's no medical detection or cure for autism. One thing I'm not going to spend a lot of time on, but I just want to hit on is, unfortunately, autism, even though people think it's in the forefront of the media and we hear about it often, autism really receives very little funding in our country, which is really surprising, and I was surprised by that even in the beginning, because we hear about it, these Autism Speak walks are huge, in most of our communities. But in reality, autism really receives less than 5% of our research funding in comparison to other childhood diseases. We spend more money on things like childhood schizophrenia, which is extremely rare. But we spend a lot of money researching it than we do on things like autism. I put an example in the bottom. I've not updated it in about 8 years, and so it's definitely not current, but the example really fit, and so I leave it in there. Example, if the National Institute of Health in 2012 had a almost $31 billion budget, 169 million went to autism research. That was less than 1% of the National Institutes of Health. Now, I'm sure that's changed to some degree, obviously, throughout the years, but that was the percentage and the amount that had went towards that, and it's a similar kind of idea at this point. It's less than 5% of our funding. So that prevalence, 1 in 54 children diagnosed, makes it more common than childhood cancer, diabetes, and pediatric AIDS all combined. Our prevalence, as I just showed in that last slide, has continued to go up every time data is released. The prevalence significantly goes up as well. And that is not a pattern that we have stopped or changed or anything whatsoever. So what does autism look like? I'm going to tell you the DSM characteristics. I'm not going to go through it word for word, but I'm going to tell you what it looks like in real life and what we actually see. What is actually autism? Autism are neurological differences in the brain. These neurological differences make it difficult to predict the intention of others. That's what I was telling you earlier in terms of that anxiety piece. Comprehend gestures and social cues, and share intention with others. So this is vitally important. Part of our autism brain structure means we do not typically share our intention. So what that means is that we are not intentional when we are misbehaving oftentimes or doing something against the norm. And that is vital to understand. Now, I will give a small caveat that says, especially as the higher functioning kiddos, as they get older, absolutely become into teenagers, and we do see some of that behavior. There is intentional misbehavior, so some kids do intentionally misbehave. But a lot of times what we see, these things where kids sometimes will act out in the supermarket or, getting into the car or things like that. And in reality, if we could go inside the brain of somebody with autism, their brain may be shouting, things like, I have the wrong socks on. These are the wrong socks. My feet hurt. This is not comfortable for me. I can't leave the house with these socks on. I can't do this. None of those words have come out of their mouth. Instead, I say, okay, Johnny, it's time to go. We're going to school now. So I've been very, very, I haven't used too many words. I've been very clear, but my kid has the wrong socks on and they're really uncomfortable. And that's all that their mind is being flooded by, I have the wrong socks on. I can't leave the house with these socks on. But my words didn't come out that way. And so what it looks like is I'm going to throw myself on the ground, or I'm going to start yelling or screaming because I can't leave the house like this. And so I hope that helps illustrate sometimes some of the examples of things we hear about, kids that are, all the time they're having, they're having meltdowns and I can't do anything and everything is not right. And, we hear about these things and I say, I totally understand. And the behavior is out of control. But that behavior sometimes is not intentional or malicious. They literally do not have the words or the ability yet to cope, to be able to speak in that way and to be able to say that. So, I think that's a really important piece. Vulnerable in social situations. So, the example I gave you earlier of my 8th grader I was talking to yesterday, he's deathly anxious now at this point to even say hello to people in public. His mom says hello to people and he physically curls up himself. He's embarrassed that she's being social. And it's because he's had so many situations where he's felt vulnerable and it hasn't gone well. And so now at this point, he just doesn't want to try at all. He's embarrassed when other people try. He's a little higher functioning and we talk it through and he says, it's so awkward and weird. It's so uncomfortable. When him and his mom and I are both saying the same things. I get it, buddy, but you just got to start practicing it. It's never going to feel less uncomfortable if you don't start practicing it. But what I'm asking him to do is to be vulnerable again. And that's a really scary thing. And that's really difficult for him to do. So they feel very vulnerable in many situations. Research also shows that those with autism, their brains literally do not fire in certain ways when they see people's faces. And so this is really important. And, another way to illustrate that these are brain conditions here that we're talking about. So oftentimes, there's really interesting research out there that shows that they process people's faces as objects. And so they don't see the emotion. Like, for example, I may process your face literally as a circle in the screen, a sphere. So I don't see the smile on your face or the frown or the tears rolling down your face. I may not see those things. I see you as just an object, or I just see you as broadly as, but you are mom. I don't see all the rest of the details. And so that's really important. They're actually their brain is actually firing differently in terms of that. So what are the diagnostic criteria? I will say this. So many of you have probably heard the term Asperger's disorder, or pervasive developmental disorder not otherwise specified, which was called PDD-NOS. Oftentimes we still use those terms because they were around for a really long time, and we use them oftentimes to describe our highest functioning individuals on the spectrum. And there are many people on the spectrum who have a positive association with the term Asperger's and want to keep it. And we still hear about it all the time. And most people know what Asperger's means. And so you'll hear it all the time. In a couple of years ago, our diagnostic criteria lumped everything together. And there was a bunch of reasons for that. And there were some good reasons for it. And there's some reasons that people have struggled as well. But for now, everything is lumped, is one thing right now. And it's called autism spectrum disorder. So it's an umbrella term that covers what was previously autistic disorder or autism, Asperger's, and a couple of other kind of our other developmental disorders. We now also say things like with a language delay, and we talk about the severity. So I have this listed. I am not going to read this one by one for everybody. I will, if you would like, we'll send you the PowerPoint so you can see it. It's literally how we diagnose autism. And what it talks about are these deficits in social, emotional, the reciprocity, the back and forth part of our stuff that I've been telling you about. That's the social, emotional learning. And it talks about the difficulties in nonverbal communication. And then it also talks about things like understanding relationships and that true social piece. The next part of autism talks about those restrictive, repetitive patterns of behavior. So as I was telling you about, we have many or most of our kids that have some way where they do better when they're on a routine, or they have restrictive and repetitive things like light switches, or lining up cars, or keeping our toys in a very specific way or manner. These are all ways to decrease anxiety for our kids on the spectrum, but they're also ways in which we can say, okay, that's a characteristic typically of our kiddos on the spectrum. Then we also just see things like these things it's not totally an intellectual disability. If it was, we would call it that. It's not other things. And then the important one here is that it says symptoms cause clinically significant impairment. So by that means it says if I'm diagnosing autism, I have to look at school, home, and any other environment that they're in, because it can't just be at school or it can't just be at home. We also then say, does it have an intellectual impairment or a language impairment? So was there a language delay? Are they struggling with that? Or do they have an intellectual impairment? Because we were also testing their cognitive ability, their IQ as well. So and in this chart, the other way that we've done it is we've said now there's a level system. So obviously, I'm not going to read any of this to you. What I want you to take away from this is that the level system, there's 3 levels. Level 1 means requiring some support. These are our kids who previously were diagnosed with Asperger's disorder typically. So these are our high functioning kids that have some inflexibility. They meet the criteria, but oftentimes they're able with support to be mainstreamed or to be, in social settings and whatever and everything else. I'm going to skip to level 3. Level 3 is typically are there nonverbal kiddos, or they're kiddos that need very substantial support in terms of that. Now, these are the kiddos that are going to be able to qualify oftentimes for lots of things like ABA therapy and help in the home, which is really, really needed for them. Level 2 is kind of the one that's kind of down the middle. So level 2 is in between those two, where we're going to say they require substantial support, but not to quite the same degree as our level 3 kiddos, but a little bit more than our level 1. So that we're going to say they are going to need probably, like, they're going to be partially verbal, likely partially verbal, but still probably needing fairly significant help, like in a school setting, for example. That might be like a level 2 kiddo. So it gives us a way to differentiate between those level 3 kiddos who need substantial help and our level 1 kiddos that are kind of our Asperger's disorder, or our what are now called level 1s. What does this all mean in kind of in everyday terms? This means that, that there is a severe impairment in social interaction for most of our kids. There is oftentimes isn't a give and take in conversations. So, we might have a kiddo who goes on for a half an hour talking about Minecraft, for example, and knows everything there is to know about Minecraft that's ever existed, or whatever the video game might be. He can have a conversation, but it's a pretty one-way conversation. If you can ask a question about Minecraft, you might be in the conversation. But oftentimes they struggle with things like, but how are you doing? That opposite part of that conversation. And that's why they really struggle with the social, because if I talk at you about Minecraft for 30 minutes, how many of you are going to stick around and be my friend for very long, right? Not many. It's not fun for you anymore. And so that's that difficulty in social interaction that many of them have. We also see a lot of development of these restrictive, repetitive patterns of behavior, where they really, they have very specific interests and they don't deviate from some of those interests. These things impair them in home, school, with their friends, everywhere. You can see how they would be really impairing for a lot of kiddos. Oftentimes these level 1 kiddos especially are kind of like, we hear this character, this quote is this normal kid acting a little differently. So sometimes they're just a little bit odd, but they can, a lot of times, they can fly under the radar for a lot of things. This is why it is especially difficult for our girls to be diagnosed, because they do kind of go under the radar for that. Oftentimes they're kind of aloof or awkward. They want to fit in. And they seek social interaction, but they don't know how to do it. I always give this example. I worked with a child who was going to a public middle school. And if you've ever been to a public middle school during their lunchtime, you'll know what I'm about to describe to you. It is chaos, for lack of a better word. It's complete chaos in the main lunchroom for a lot of our kids. They have sometimes the whole school and sometimes, whatever it is, but they're all eating in a cafeteria. Some of these schools, the bigger schools, you can have hundreds of kids eating in a gymnasium at one time. So you can imagine it's loud, it's chaotic. Even the organized ones, obviously are just loud and chaotic because of the amount of kids. We had been talking about how to walk up to somebody and start a conversation. And he was so motivated. And I will paint the picture to you that this was very typically, my kiddo was very, very awkward, very geeky, and I loved him to pieces. He was awesome. And he was, but he was completely a nerd, and he knew it and he felt it and he owned it. That was who he was. He walked into this very crowded lunchroom and I heard the story afterwards in an IEP meeting. He walked directly up to the entire group of kids who were all decked out in New England Patriots football jerseys and everything like that. And it was very clearly not likely to be his friend fit. He walked up to this group of jocks, basically, is what he had done. And he just completely picked the wrong people. They laughed at him, unfortunately, and it didn't go well. And again, he was thrown into his cycle of, this isn't going to work. Why am I even trying again? And part of the reason was he didn't have his people. And if you've ever been in any presentation with me, or if you've ever been my client, you'll know that that's my term. We have to find their people. Once we find our people in life who we truly fit with, we can be ourselves. They are understanding. We don't have to be perfect socially. And we can keep trying again and again until we find our people. then we are typically rejected a lot of times socially. They don't stick around if we're awkward. And so that's kind of my example of, you know, them not finding who they really were, probably should have started with. Not to say they can't be friends with the jocks, but it's probably not the group of people that I would recommend that they walk up to and start their interactions with. So you understand the socially awkward, we have less eye contact with people. I went over that earlier. A lack of showing of empathy. It is not a lack of empathy. There's a difference. Our kids and adults on the spectrum have a tremendous amount of empathy. If you put them around young children or animals, you will typically see it immediately. So it's a misconception that that kids on the spectrum do not have empathy. They do. They don't show it. They don't know how to show it in a safe way oftentimes. These kids often don't understand nonverbal communication and may melt down in public places. And you heard me kind of talk about why that might be. Interested. Also, my reframe is they are passionate in a particular subject. So the kids that are gamers, for example, that all of a sudden they're spending 10 hours a day on electronics or YouTube or whatever that may be. Here's the reframe. They have a passion for it. So why not start putting these kids in things like online camps for coding or programming or things like that, right? Bill Gates and Steve Jobs, where would our world be without these men? A totally different world. Why not turn this passion into something productive? So oftentimes we have kiddos that are very stuck on one topic, but oftentimes we can make it into something that's a little bit more productive in our environment as they get older. I mentioned there's no give and take of conversations. We do typically see, especially our level 1 kiddos, this is a total generalization, but our level 1 kiddos do typically have average to above average intelligence, and that shows and we see a lot of times differential learning. So we'll have kids that are super intelligent, very highly intelligent verbally, and these are the kids that never shut up, right? Like they just talk constantly and they talk about everything and they learn everything about topics and they talk to you about that topic incessantly. These kids often have above average verbal intelligence. Now, the differential learning part also though means that oftentimes these kids have a slower processing speed or a slower nonverbal intelligence or something as well. And so oftentimes it's not all you know, they're not streamlined in terms of all of them, but they have parts of their intelligence that are really high oftentimes. Many of our kiddos appear clumsy, so the lack of coordination is part of it. You know, we don't oftentimes have a lot of our kids that are in team sports, especially. Sometimes we do, absolutely, and if they do it, that's amazing, but not often. Speech patterns are sometimes unusual. Many of you have probably heard some of our kiddos use very monotone speech or very loud speech. You know, some of our kids have difficulty managing their tone of voice and their volume of their voice, their pitch. Some of our kids have a formality to their speech. They really struggle with using things like slang or new words for things, and that's difficult once they become teenagers, because teenagers use a lot of sarcasm and a lot of slang words, and so if we're not comfortable using some of those things, we're gonna have some difficulty in social communication, especially as we get older. There are many comorbid conditions with autism. And so a lot of times we see kiddos that have gastrointestinal disorders. We can see obesity. Part of that is because of the sensory piece that can sometimes go along with autism. And so we do have kids that, from a sensory perspective, only eat certain foods. You know, stereotypically, you'll hear kids that eat chicken nuggets and French fries. And there is not only is there, there are lots of different components to that, but there are, the gastrointestinal part of it, but there are sensory pieces of like, this is the only thing that feels okay in my mouth. You know, I've heard stories of people that, you know, moms that have literally tried everything. They've tried, and the kid will eat McDonald's only. Like you get, you could get Wendy's chicken nuggets and the kid's not going to touch them, but they'll eat the McDonald's chicken nuggets, for example. So, you know, there's kiddos that are very, very specific in this. And so because of that, we see a higher chance of obesity and things like that. Sleep disorders, which is also a sensory component. So some of our kiddos on the spectrum sleep really well and others never sleep well from the very beginning. They're difficult sleepers. I hit on earlier, but anxiety and depression are our big comorbid conditions that go along with this. And then that last one, which we need to be very aware of, are suicide attempts. Now, that in and of itself is literally a 2-hour presentation. So I'm not going to go into detail on that one today because I could literally go on and on about that. But it does go hand in hand with that anxiety and depression. And oftentimes, you know, imagine if you've been socially rejected for your entire life. How do you feel by the time you get to high school, especially? You know, not to mention in our, you know, that slang piece, and a lot of our high schoolers say things to each other like, "Oh, go kill yourself." It's a very unfortunate, you know, part of their communication, and it's something that needs to be changed, but it isn't changing very quickly, and it's been around for a while. And so, you know, when you have kids who take things in a very black and white way, you know, these things don't help. We also have a diagnosis called social pragmatic communication disorder. I'm not going to spend a lot of time on it. It does exist. We don't diagnose it as often. And basically what it means is it's the social part of autism without the behavioral rigidity part of it. That's how I would simplify that. And we do see it at times. Now, I will say that oftentimes people diagnosed with social pragmatic communication disorder are not getting the school accommodations that a kiddo with autism would. So I'll say that. Differential diagnoses. So we do see with kids on the spectrum, all hand in hand, we see things like ADHD, anxiety disorders, including OCD, but anxiety disorders typically, depression, and learning disorders. Really quickly, I want to make the differentiation between OCD and the rigidity in autism. So a child with autism and who is, say, lining up their cars or touching things a certain number of times or whatever it may be, by doing those things, their anxiety is decreasing. A child who truly has OCD, by doing those things, by doing the light switch 13 times or whatever it may be, their anxiety is actually increasing. Someone who has OCD typically knows that that is not typical behavior and that they shouldn't be doing it. Someone with autism does it to decrease their anxiety and then they can move on. So I hope that makes sense to some of you. If you have more questions about that, you can always let me know later on, but that's kind of the differentiation between OCD and anxiety and autism rigidity piece. There is no cure for autism. Most people that are diagnosed on the spectrum don't want there to be a cure necessarily either. Most people on the spectrum do have a pretty strong identity related to it by the time they get to become an adult. It's a process throughout childhood, but nonetheless, there's no cure. What we do instead is we build up strength and support challenges in our society. You know, my example, I use it again. Where would our world be without Bill Gates or Steve Jobs? Bill Gates is reportedly said that he's diagnosed on the spectrum. Steve Jobs was rumored to be for his whole life. And it's easy to understand a lot of times if you see interviews with them, you can pick up on some characteristics and stuff. And I tell kids all the time, where would our world be? Like, we need brains that work like yours. And so it's oftentimes, you know, the cure is not the goal. The goal is to find coping skills and is to be able to find ways in which our lovely kids, adolescents, and adults can flourish in our community instead. Children are oftentimes medicated. This can be a controversial topic, and it is a very personal decision for parents especially. There are absolutely mood stabilizers and some antipsychotics, ADHD medications, antidepressants, things like that, that work for certain kiddos. And don't for others. It's a very personal decision for parents to go through, but there are many kids who are medicated. And that again is what works for one kid is not going to work for the next. So it's a decision that everybody makes differently. I emphasize this, that autism is not a disease. We need to talk to kids when they're diagnosed that it is not something that they can pass on, that they can, that anything like that. It's not a disease. It's not medical. It's just the way that their brain works. And when I tell kids about autism, we talk about the uniqueness of all of our brains. And I say things like, your brain is unique and it works in a certain way. And there's a word for it. There's not a word for mine, but that doesn't mean that mine's not unique as well. Yours is just unique in this way. I'm going to highlight a little bit of the treatment. I know it's just about time for Allison to start, so I'm not going to go into detail on some of these things. But some of the things that we do are things like we're really concrete with kids. We in therapy, I'm not going to use a lot of flowery words. I'm going to use a little bit more command language to get their anxiety down. Once I've done that, we can do a lot more of other things. I'm going to teach concepts and skills using things like social stories and helping them to understand, this is what social skill treatment is. A lot of times we do social skills groups. Our practice runs them. There's lots of practices that do, but there are things like I teach you a skill, we practice it right away, and then we talk about other situations that you might be able to use that skill in. I'm going to teach things like that can generalize to other situations. The example I was given this one is I taught a younger child at one point the W's of appropriate behavior. And this kiddo was a crier. So he tended to just start crying anytime he was frustrated, anywhere, public, private, anytime. And so I taught him the W's and he was able to really understand. So when is it appropriate to cry? Who can I cry around? Where is an appropriate place? And so he understood when I'm in a safe place with a safe person, I can do whatever I need to do. When I'm at school or, in the grocery store or wherever else, I need to use some of my other coping skills, and this is what I need to do. So sometimes it's just kind of teaching them very specifically, like, here's exactly the behavior I want you to show and when. I used an example earlier with some scaling, and that's oftentimes very helpful. So teaching kids things like 1 to 5, and I do that with myself or parents and with the kids. So the example I used earlier was, kids don't always see their parents going from 1 to 5, right? And they don't feel themselves they went from 1 to 5. And so I've had tons of kids say to me, I was fine, and then I was crying. They missed that whole middle of all of that. And so, we need to spend a little time teaching them, what does a 1 feel like? What does a 2 feel like? What does a 3 feel like? So that I can say to them, by the time you hit that 3, you need to be doing all these different coping skills in your arsenal, because anything above a 3, we need to get to a safe place, and so I teach them things like that. So, those are the kind of things. We do have specific therapies, and I put them in here for you. I don't plan to go over them, but we do, many of you have heard of ABA therapy. So the specific type of therapy that's done typically in the home, and it's much more intensive. There's a few other ones, pivotal response training or PRT. That also is done, in a similar way as well, and very intense work as well. These things are done, everything that we're talking about is done typically in the home and in the school, because it's, our kiddos show difficulty in both experiences. I have a slide here of my sample IEP accommodations. I don't mean for you to read all of these right now as well, but, I just want you to see that there are a lot of IEP accommodations that we can put in and that we talk to teachers about, things like helping preferential seating, designating a safe person in class for them to go to, teacher chosen partners. So when the teacher turns and says, okay, everybody partner up, most of us understand the anxiety that goes with that, right? And most of us not diagnosed on the autism spectrum can understand how that's an anxiety provoking statement for a teacher to make. If you're on the spectrum, that's a triple anxiety producing statement, and so oftentimes we put in teacher chosen partners or groups to help with that. So there's tons of different accommodations that we can put in depending on the strengths and the challenges of each of the kiddos. We do see lots of effects in terms of the day on daily life, in terms of peers. We do, social skills groups are very helpful for kids across the spectrum. They are typically done in a way that where we match up in terms of functioning level, and age, and oftentimes gender if possible, but not always. As kids get older, the genders are mixed typically. But there are some groups in which we do like 8 to 10-year-olds for a social skills group, and then maybe like 11 to 13-year-olds would be ideal. So we match them up in terms of their functioning and where they're at, and those other factors as well. But social skills groups are really important. So are things like being assessed when you're going to the pediatrician. So all children at their 18 and 24-month checkups should be being assessed for autism. It's called the MCHAT. If you or your family has a child, has an infant in your family, please do make sure they're being assessed for that, because earlier diagnosis is always associated with better prognosis, always. The last thing I leave you with, and I don't have it linked because I knew I wasn't going to have enough time because I talk too much, Debbie, is a video. I leave that link in there, and I would encourage you to screenshot this or take a picture now. I cannot encourage you to watch these videos of Alex. His name is Alex Olinkowitz. He has multiple videos on YouTube, and he is a wonderful adolescent. He's now an adult, actually, but when I started showing this, it was an adolescent, and he is a wonderful, wonderful example. He makes videos telling his public what autism is and how it feels to him. And I honestly cannot encourage his videos more. They have visual examples and him talking, and they're wonderful. So I highly encourage you to take a look at that at some point in your free time, because it'll demonstrate a lot of what I've just talked to you about for an hour, but it's a really good example of that. So I'm only 3 minutes over, Debbie.
That's okay. You know, I can never keep time because I get so involved in the presentation. So that's excellent. So I guess we're probably ready for Allison.
Hi, Debbie. I'm here.
Okay, good.
So
Yeah,
I'm just going to click stop share, right, Allison?
Yep.
Yes, ma'am.
Okay.
Okay.
All right.
There you go.
Thank you so much.
Awesome. All right, Debbie, I have to head out, but I thank you so much, and I'm going to watch the rest of everything as soon as I can, and let me know how to get the PowerPoint to everybody as well. I appreciated everybody's time.
Yes, I can take care of that for you if you just want to send it to me. And again, thank you so much. I really appreciate everything you and all of the ladies at Palm Beach Behavioral Health and Wellness. You are my peeps.
Thank you. Thank you, everybody, for your time. Have a nice day.
Bye.
All right, Debbie, I'm going to try to get this up if you want me to start, or do you want to take a little break? It's really up to you.
I think we can get started. We got a little late start because I think some people were new to Zoom, but we have about 100 people attending. So you want to go for it?
Yeah, let me just I have it right here. Okay, can everyone see it?
Yes.
Okay, good. All right. So my name is Dr. Allison Bordeaux, and I am currently a therapist at Palm Beach Behavioral Health and Wellness. But for the previous 6 or so years, I was actually a clinician at FAU Center for Autism. And so I kind of worked with a predominantly adolescent and young adult population there. And over the time that I was kind of there, I started to notice that some kind of interesting shifts were happening in terms of how we were viewing how to have conversations with our individuals on the spectrum. And so a lot of my current work and research is related to this idea of topics of personal safety, hygiene, sex education, consent. And so I wanted to be able to share with everyone today some of the work that I've kind of been doing related to these topics, just because I think, Kelly was talking about a lot of, the historical stuff related to school, stuff related to kind of behavioral interventions. But as this population ages, we're starting to notice that there are kind of gaps in between, you know, what we would traditionally talk about versus kind of how we need to catch up a bit. And so I wanted to be able to share some of that with you today. I can access the chat box in and out a little bit, but also I have my contact information at the end if there are any specific questions. Sometimes these topics can be a little bit more personal, and so I have my email there, and if anyone wants to ask anything, I'm happy to answer to them directly. So first, starting with this idea of like the rationale and social rules. Why are we having these conversations? A lot of what we understand related to kind of sex, sexual behaviors, arousal are things that we pick up, right, inherently. Kelly was talking about how, you know, these social cues, a lot of times with individuals on the autism spectrum, social skills need to be taught more directly because those social cues aren't picked up. And this very much connects to this idea of how we interact with others, how we have relationships. You know, like I said, we would traditionally think more in terms of friendships and social relationships, but coming off of that is romantic interest, dating, romantic relationships. And so I think it's important to kind of take that and move forward a bit as our population ages. This idea of the rules of engagement for, you know, kind of more personal and more specific relationships, they are often contextually specific. You know, for example, the type of relationship I could have with just someone I met on a dating app versus someone that I meet at work that maybe I'm interested in. It can vary, and there might be specific rules related to that. And so it's really important to kind of understand that these conversations might need to be had more directly. The variations in these rules are not often explicitly taught, which is kind of where the wheels fall off in a lot of these ways. And at the end of the day, understanding that social, romantic, and professional success, it's linked to the ability to successfully navigate these different contexts and how to manage relationships between them. And so this isn't necessarily something where we're just teaching it so that they have the information, but we're teaching the information so that individuals overall can kind of assimilate it so that they can have long-term success moving forward. So how this impacts individuals on the autism spectrum. We know that explicit communication is very effective in terms of a strategy. If I am a logical and concrete thinker, if you just kind of say what you mean and mean what you say, I'm going to understand it more clearly than if you kind of talk around in circles. Unfortunately, we as humans tend to not say those things, right? We tend to feel like maybe being more direct or explicit is rude. And so that disconnect between how people can really process information most effectively versus how people are really communicating in the world is really where we see the kind of problems arise. Social cognition, and I can't recall if Kelly mentioned this or not, social cognition is essentially kind of a next step off of social awareness. So we have social awareness. I understand that there's a world out there that is social in nature and there's some rules. Social cognition is the ability to have that kind of higher level skill where I can understand that perhaps in certain situations I might need to pivot. So it's essentially kind of that like higher level troubleshooting piece of social skills. This is often an area in which we see a lot of kind of challenges for people on the spectrum, because if I'm not picking up those subtle nuances and where things shift or when there is a shift, I don't know how to change. And so this is kind of this idea that I will continuously make social overtures to people, not recognizing when I'm either being rejected or neglected. And I don't know how to do it differently. I don't know how to turn that corner. And so truthfully, when we see individuals on the spectrum kind of being rejected and not understanding how to turn that corner, clinically, I always immediately get concerned about how this can impact people in terms of how they view their self-worth. And I think it really puts individuals at risk for depression, suicidality, you know, the exacerbation of other underlying mental health conditions. And so I think it's really important to acknowledge this piece and how important it is to kind of try to make attempts to fill in that blank in a variety of contexts. Executive functioning, and I apologize for the acronym EF there, executive function challenges, which is, essentially the part of the frontal lobe of the brain that helps us, with decision making, planning, troubleshooting, seeing the big picture. Deficits in that area that are associated not just with, traditional neurodevelopment, but with neurodevelopment and individuals on the spectrum. This is really where we see this being the biggest area of challenge, because that deficit causes a lot of the social challenges that we see around this time. So I kind of mentioned this idea that we really need to address things more explicitly. And so really where it starts, ideally, is identifying the difference between public versus private, right? When you have very young kids who perhaps are neurotypical or not on the spectrum, some of these things they might just inherently understand. But we do see little kids, right? They'll have a diaper on and they kind of pull it off whenever they want to, or, sometimes they take off their shirt or pull off their pants and they run around naked, and everyone laughs, and then, we teach them, don't do that, and then they figure it out. There are some individuals that don't necessarily understand that, if I can do this here, I can't do that there, right? And so a lot of times with, previous experiences I had both as an educator and as, a clinician working with individuals on the spectrum, is that sometimes if we don't address those directly, it can be problematic, right? And what we're doing is, instead of thinking proactively and teaching what we want to see, we kind of wait till something pops up, right? Something kind of happens, a problem, or, certain things happen, and then we have to kind of retroactively address it. This kind of goes counter to what Kelly had talked about with the ABA and the essential belief of the antecedent behavior consequence chart, where the antecedent is what happened right before that caused the person to do whatever. The B is the behavior, right? Whether it's desirable or not. And the consequence is what happens after that. And so, for example, I recently was on a Zoom session with a teenage client, and he is on the spectrum, and we are kind of chatting and, going back and forth. And at some point he just decided to take his shirt off. There was nothing said, nothing kind of happened, but he just kind of whipped his shirt off. And I realized that I was now at a point to really teach something, right? To kind of have a real concrete moment to kind of discuss like what just happened. And so we had a bit of a conversation. He indicated to me that he was hot, and so he felt like he could just take his shirt off. Now, in a in vivo session, it would probably be a little bit more clean to explain this, because when I kind of discussed with him the idea of, we are in a therapy session, we are communicating with one another, you can't disrobe. He said, well, I'm in my house, which, I'm thinking, fair, you're at your own house, you can take your shirt off, right? But truthfully, the idea is that we really want to try to teach these rules as early as possible, because if we don't, we kind of run the risk for things to be kind of filled in to people's detriment. They kind of make up the rules as they go and don't necessarily understand. In some of my research, we've come across situations where, in particular, the big topic that tends to come up when we see kind of adolescents and young adults is masturbation, and when can I do that and where can I do that, right? And when I was teaching at a school for individuals on the spectrum, what would happen was, is because they were doing it at home, maybe in their bathroom, they felt that they could do it in the bathroom at school. And for school professionals, that can be kind of problematic. And so I think the idea of really kind of framing it in terms of what is appropriate and what you can do, right? And in schools, we'll often talk about what's acceptable in terms of rules, as opposed to don't do this, don't do that. And so those conversations are really important to have for that reason. Another kind of thing that can lead people to believe that perhaps we don't need to have these conversations is this idea of masking or camouflaging. And those two terms essentially refer to this idea of, I kind of fake it to make it. maybe I don't know how to interact socially, or I don't know what I'm supposed to do, but I kind of observe others and I get what people are doing and I kind of do it the same, right? If I'm trying to fit in, I kind of maybe act how other people are acting. And so I think that sometimes, particularly in individuals that are, perhaps perceived as quote unquote higher functioning or level one, that idea that they're masking to a certain degree might kind of communicate a higher level of competence in certain situations that does not necessarily exist within that individual. And also I think when we're having these conversations, sometimes if we don't feel like we need to have it, maybe we don't want to have it, right? But truthfully, in order to kind of provide for the overall safety of the individual, we would really need to try to address public versus private, and within multiple contexts. So as I kind of mentioned, back when I was working at CARD, we did a lot of consulting within school settings because, this is something that's really important. For school professionals, it can be really difficult to manage some of these more delicate topics just because they are school staff, right? And understanding where the school philosophy and the individual's family philosophies perhaps are in line or diverge. Ultimately, as many professionals that can be participatory in that team, we would want them, other therapists, other behavior specialists. Interventions may or may not look the same between the two settings of home and school, just because of the obvious nature of, the home being more casual and less structured, and the school having more specific rules related to kind of the privacy and safety of others. So one of the reasons why, these particular topics became very relevant to me is that I recognized that there was this kind of conflict between the idea of topics versus issues, right? Talking about sex and other behaviors and education related to it and body curiosity can be kind of complicated because we get kind of uncomfortable. Well, that would be a good start. And also, sometimes these elements conflict with perhaps our own judgment base, our own morals. And so I kind of understood that there is a difference between topics and the issues. Topics are things that are based in fact. Whether we like them or not, they happen, right? Whether we want them or not to happen, they happen. And issues are related to the lens in which we view that. So the example I've always kind of given is, young women, right? They grow hair on their legs, right? This is something that just biologically happens. Now, that's a topic. That is a fact. It is going to happen. Now, the degree to which it is either appropriate or not appropriate for that individual to shave her legs when she's young. Now, that's an issue. That's related to somebody's specific base, right? I was raised as Catholic, and so I was told I was only allowed to shave to my knee. I don't really understand what that was about, but that's how it was communicated to me. So it's the difference between what actually just happens and how we manage it. And so understanding the difference between the two, I think, can really help us address things in a more clear way, because otherwise we can really feel conflicted about many things. So body curiosity, it is part of typical development in humans, right? Just our own interest in ourselves. And atypical neurodevelopment does not equate atypical sexual development, biological development, any of these things. And so, it's really important to understand that perhaps we might not be seeing, our child, our partner, ourself, feeling or expressing some of these behaviors, but much like empathy, the behavioral expression of empathy is kind of complicated because we're used to seeing it look the way that we express empathy, right? When someone's upset, we might put our arm around them, we might try to console them. And so when individuals on the spectrum don't behave that way in certain situations, that's kind of where this idea of they don't have empathy came in, when in fact they have considerable amounts of it, but the behavioral expression of their empathy just looks different. And so I think it's very similar in terms of their feelings related to sexual development, their hormones, all of this. This very much exists, but the way that they express it might look different. And so that's kind of what we have to kind of, connect with in terms of how to move forward most effectively. The disability does not affect interest in a specific way, but there are some individuals on the spectrum that will communicate that they don't necessarily have interest in either romantic or sexual relationships. There's some interesting kind of research related to that, but nothing concrete as to perhaps why that is. It could be related to sensory, it could be related to perhaps some social connectedness, or challenges in navigating the cues. But just understanding that having a disability in of itself does not necessarily mean that it generalizes to sexual development and interest. The other part is that if we are seeing certain behaviors related to body curiosity, we need to kind of be careful not to inadvertently reinforce something that we don't, right? With all behaviors, sometimes in our best attempts to kind of manage things, we might reinforce something that we don't like, or that we don't want to happen in certain circumstances. And so it can be kind of complicated, and that's why having other professionals and other team members to kind of process with and develop a plan is usually the most effective. So in terms of when we're addressing certain challenging sexual behaviors, one of the things I always like to point out is this idea of not setting impossible rules. In particular, one of the ones that's come up, in other consulting situations is this idea of saying, don't touch yourself. You don't masturbate, don't do that. And unfortunately, as much as perhaps maybe it might, kind of fall against our moral views or our religious views, body curiosity and interest in all of this is a fairly typical human development experience. And so this idea of saying don't do that really sets you up in a place where it's still going to happen. It's just going to happen when you're not looking. And so, you really want to try to frame it in a way that is allowing for everybody to be safe and things to be appropriate and it not to cause challenges, but not setting yourself up essentially for failure. And the other part is this idea of how it will impact the individual over their lifespan. So in a lot of situations where we see very young kids who perhaps are engaging in some exploration, being careful not to use words like that's dirty and that's gross, because, unfortunately, in an attempt to perhaps kind of stop a behavior, what it might do is communicate to that individual that, something about them is dirty or gross, right? In the same way that we would tell, and teachers in terms of best teaching practices, we encourage people not to say things like good boy or good girl, right? We don't want individuals to attach their self-worth to kind of generalized statements. We would want to kind of make it more specific, like you did a really nice job cleaning up your room. So we want to kind of take that into consideration with these more delicate topics moving forward, that we don't confuse individuals as to kind of who they are and what, their body awareness means as well. And in terms of these interventions, really ultimately looking for an elegant solution, right? It doesn't have to be a really complicated or elaborate, intervention. It can sometimes be pretty simple, minimal effort, minimum amount of steps that achieves the desired goal. So in terms of determining the intervention to address some of these behaviors, we would just need to really put together a list of the areas that need attention, and identify the social motivation of the individual. What is it that drives them to be interested in maybe, developing relationships or kind of taking care of themselves, engaging in, personal hygiene. Defining and managing expectations tends to be one that comes up as kind of problematic, just because the expectations of perhaps the caregiver versus the individual can be different, right? And this would come up quite often when I was running social groups for CARD, is that a lot of the adults that I worked with, that one time a month that we would go out bowling was enough for them. But the parents would be concerned that perhaps they need to be getting out more, doing more. And so understanding that the expectations related to relationships, engagement, hygiene even, might be different than you. But we really want to try to develop things that are acknowledging the individuals on the spectrum's kind of comfort level, sensory needs, and interests as well. And when we develop these interventions, we want to utilize the methods that we know work most effectively. Explicit instructions, we want to be using visuals, modeling, behavioral rehearsal, schedules and cues to try to reinforce what is desired and decrease undesirable or challenging behaviors. It essentially goes back to the elements of behavior, which are frequency, intensity, and duration, right? So when we are increasing or decreasing behaviors, we want to look at those three elements. And that can be often the biggest challenge in determining these interventions. So when looking at the context of relationships, we need to understand that there's different ones and that we really need to teach the different ones. And, I've done in the past some pretty extensive all-day trainings for, teens and young adults on the spectrum to really kind of highlight the differences in relationships. But when we're thinking of, kind of teens and young adults, understanding these different elements, these five, is really important for them to understand in order to be as successful as possible moving forward. Because sometimes things can seem, kind of blended or confusing. And so the more that we're able to explicitly address what the different ones are, we provide them with a lot more information to move forward. So safety and consent, these are two really important things. And I think when we're talking about things related to sex education and body curiosity and hygiene, we might not all agree on how to go about it or to go about it. But I would say this is that my biggest concern is that when we are not addressing these topics related to different issues of our own, we really can put people at risk. Because individuals with disabilities are considered a vulnerable population. And because of that, and because of my challenges in reading social cues, and perhaps also because I have spent a lot of my time being rejected, when I do get accepted, I might just take advantage of that acceptance without questioning whether it's a good choice or not, or a safe choice or not. And so I think, we might disagree on whether or not talking about sex and body stuff is necessary, but I really strongly feel like if we're not setting the standards and we're not setting the tone, we're really putting individuals with disabilities at risk for having somebody else do that for us. And that really concerns me because, there's a lot of predators out there who, and people without disabilities are being taken advantage of. And so I think it's really important to try to have explicit conversations. And not just to teach individuals how not to get taken advantage of, but also to teach them the importance of consent so that they don't get in a situation in which someone thinks something differently of them than they intend. So in terms of personal safety, what we really need to start with is this idea of what is the individual's level of social awareness? How do we gauge that? How much are they interested? Or, is this someone that, it doesn't really understand if someone's trying to talk to them or not? Because that really determines how we move forward and how much kind of back teaching, that kind of logging we have to go to get them to a certain degree so that they even understand that certain things are happening around them. Their orientation to the environment is another one related to personal safety. I would say that I think a lot of people, really kind of struggle with this just in general because we are such a, kind of always looking down at our phones, always kind of distracted society that it can be really challenging to keep yourself aware of your surroundings. I'll oftentimes see, teenagers kind of walking around with their heads down, not paying attention. And I think, there's a lot of things that can go wrong if you're not aware of kind of what's around you, who's behind you. So that's something to really kind of consider. Social interaction, where are they at with it? Are they someone that has kind of a higher level of social awareness, meaning they're a little bit more cued in and they make overtures and maybe they know that something doesn't go right and they kind of get rejected? Or are they somebody with kind of a lower level of social awareness where they make the overture, they don't necessarily know that they've been rejected, people just kind of neglect them a bit because they're like, they don't get it. and then they're going to continue to do the same thing over and over again. And so we would approach it differently for the different levels of their awareness. Their degree of expressive communication, how effective they are at that. I mean, this also, when we're considering individuals who are nonverbal, how does this look for them, right? We're not just considering it in terms of the individuals who are, you know, that level 1, but we're also considering it in terms of individuals who might be that level 3 that require AT in order to communicate. And their behaviors, right? So we need to kind of know what behaviors we're looking at, what behaviors they're expressing, and what might be potentially problematic for them. So, okay, so it looks like, I apologize, it looks like this is a little bit of a repeat of the determining intervention slide, so I'm just going to skip through that. And one place where I found some pretty good resources related to kind of consent and all that is, you know, a significant portion of Planned Parenthood is education. And interestingly enough, they do have a disability specialist person who works within their community, and they come out and do talks. And so if this was ever something that you were interested in, they do have a lot of resources, educational resources, and they also have individuals who can support that for populations that are, you know, that are, you know, like younger kids, but also people with disabilities and older. So it's worth noting that you don't necessarily have to do it all yourself, which could be sometimes a challenging thing. Is it like, where do I start with this stuff? So this was a cool acronym related to the idea of consent, that it is freely given, reversible, informed, enthusiastic, and specific. And so I kind of like that. So I include this in all my presentations. And just kind of the background information related to consent. You know, once we have the acronym and we have all the good stuff, like a lot of times in order to kind of get that understanding, we need to kind of break it down even further. And so this is a really good, and they have this on their website as well, is the kind of information related to like, what does enthusiastic mean, right? Because that can be kind of an abstract term. So how would we make that more concrete? And what is specific, right? So we want to, and the idea of reversible, what does that mean? But I think it's important that we have some basis of how to communicate this effectively. And so I definitely felt like this was a good explanation of consent, of giving consent and receiving consent, right? We always want to make sure we're addressing both sides of that. So in terms of some of the legal quagmires that come with this topic, I would say that, you know, in my experience, you know, females on the spectrum, we know that they present a little bit different, right? And this is one of the reasons why, in terms of diagnosis, females tend to not be diagnosed as frequently. A lot of times we'll see them, you know, much later after they've been diagnosed with a bunch of other stuff. And so because of that, what we see is that there are certain patterns that happen in a lot of their lives because of maybe not knowing why certain things were happening. You know, if I'm a female who has a hard time socially connecting, I might end up in kind of an outlier group, and that might be good or bad, right? It might be, you know, kind of like the techie people, you know, the people that are a little bit more into certain, you know, kind of different things like LARPing, or, you know, into like coding or something like that. Or it might actually be the other kind of outlier group, the kids that are getting involved with like drugs and stuff like that. And so what I've seen kind of traditionally is that some of these girls, they end up kind of putting themselves at risk for, you know, kind of more abusive relationships. You know, they very much want to belong and be with somebody, and they don't necessarily understand that perhaps that person is not a great choice. And because they have limited options, they accept that, right? There's a kind of well-known female on the spectrum. Her name is Jennifer O'Toole. She wrote the series Ask for Kids. She wrote, what was it, Autism in Heels, I believe was her book. And she talks a lot about how she was kind of put, you know, in situations where she ended up in abusive relationships just because she really didn't pick up on the social piece. She didn't catch some of the signs that it was, and she didn't know necessarily that she had options. And I think, you know, individuals that are considered neurotypical, you know, report a lot of the same things. But it's interesting to note that this can be kind of a pattern if we don't really address certain things related to relationships, romantic relationships, what's appropriate, what's acceptable. So that's something to consider. You know, harassment is another one. I've kind of dealt with this in conjunction with stalking a little bit, where, you know, I might not understand that if I am kind of following someone around that I'm interested in, that it might be perceived that I'm stalking them. I've worked with some, you know, kids on college campuses where they're kind of restricted interest, you know, that part of the diagnosis, you know, restricted interest in repetitive behaviors. Well, that was one person, and their repetitive behavior was kind of following them around and not understanding the social cues to a certain degree. I don't understand that if I'm following one person around a lot, you know, 6 feet behind them, they might get uncomfortable with it. So that's actually something that's come up a lot more recently, where, you know, it wasn't intended to make the person feel bad, and it wasn't intended to make them uncomfortable. I just didn't know that it made her feel that way. Because if we think about it, the person that's being followed might not turn around and say, will you stop following at me? It's making me uncomfortable, right? So because I'm not expressively communicating that directly to the individual, they don't know that I can't do that. So I think that that's a really interesting topic to, you know, to consider in terms of how are my restricted interests changing over time, right? Sometimes we've seen that restricted interest becoming, I'm now very much interested in sex, right? And that can also be another area of challenge. I've worked with that as well, where how do we frame this? How do we do this? How do we talk about this, right? And how are we aware of what's out there, and how it's being interpreted? Another kind of area of challenge is catfishing. And if you're not familiar with it, essentially it's kind of this idea where, you know, someone puts themselves out there to be someone that they're not, right? And we see it a lot on dating sites, and we see it a lot on, you know, other kind of social media where, you know, I think that I'm, you know, dating this beautiful person, but we haven't met or talked, you know, face to face. And then it turns out that's not who it is at all. And so catfishing can be really hurtful ultimately to somebody, because, you know, not just if there's any kind of associated financial transactions, but if that's a relationship I invest myself very much into, I might not be willing to end it, even when it turns out that it's a bad choice, right? This person is not who they say they are. I've worked with some individuals, some young adults on the spectrum who really couldn't fathom the idea that somebody would lie on like a dating app, for example. You know, because it doesn't seem logical. Eventually you're going to get found out. Why would you do that? But, you know, truth, people do it a lot. They lie about their age, their height, the way they look, whether they have kids or whether they're married, right? People lie all the time. And it can be really challenging if you are a very concrete thinker to kind of understand that that exists out there, unless it's really addressed quite frankly. You know, there's also, you know, dating apps can be problematic for a lot of reasons, but just to kind of put this out there is that there are some disability specific ones. And there's one, it's like, I believe it's SB Singles. And, you know, truthfully, I don't think that there's necessarily anything wrong with, you know, disability specific apps. I think, you know, we got Farmers Only, we've got JDate, you know, we've got, you know, Christian Mingle. There's all sorts of ones that are more specific to a certain demographic. But one of the things I talk about a lot with young adults is that, you know, just because someone says on these sites that I'm on the spectrum, you know, unfortunately, sometimes people don't tell the truth. And you just have to be careful of that, because then you can get yourself in a situation where it's, you know, catfishing, or, you know, you're now giving, you know, bank information, or you're giving people money, and you know, you don't realize that you're being taken advantage of. And so it's really important to kind of address that these things exist. And other online platforms, you know, there's so many out there now. They can be kind of rife with predators, quite honestly. I mean, I know a lot of teens today are, you know, very into TikTok, and TikTok's like the new thing, but there's a lot of kind of predatory people on TikTok, and they have, you know, kind of different ways to find out your location, and they can find out a lot of personal information about you and your home just by viewing what's behind you. And so really talking about appropriate and safe use of these platforms, I think, is important. And the challenge with that is if I'm not familiar with a lot of these things, I don't really know how to have these conversations. And so whenever I talk with audiences about these topics, I really encourage, whether you are, a teacher or a therapist or a family member or, someone on the spectrum themselves, is that you really need to do your, and that research might be uncomfortable. You might not like the things that you're seeing, but you need to know what's out there, because you don't want to be blindsided in a situation where, I've had parents who didn't realize that their child was pinning their family home and talking to strangers on, TikTok, and they, very upset, realizing how exposed they were. Or even in some of these online games, very little kids, parents didn't realize that there was chat parts of it, and that, they don't necessarily discriminate by age on some of these. And so your, 10 or 12-year-old could be talking to like a 40 or 50-year-old. So it can get really kind of confusing and a little stressful, but truthfully, the more you know, the more equipped you are to be able to provide sound advice and guidance, and particularly related to topics of pornography. It can make a lot of people uncomfortable, but in particular with individuals on the spectrum, pornography can be problematic because the way that it puts out there what actual sexual relationships look like can be very confusing, right? One example I always give is that, in my research, I had come across this idea that, on Pornhub, which is one of the more, commonly known sites, there's a whole section called teen. Now that's very confusing, right? Because, all of us would know that, like, well, you have to be 18 to be on one of these sites, right? Technically, right? You have to be 18, that's the law. But the girls in these videos don't look 18, right? They're dressed and they're styled to look very, very young. And so if I'm someone on the spectrum that doesn't really, have a lot of people talking to me about this, or they don't know about this, and I'm interested in this, I could potentially get myself in a very complicated legal situation in the real world. And, we want to make sure that we are communicating, and truthfully communicating to, anyone, whether they're on the spectrum or not, that what you're seeing is not necessarily representative of a typical sexual relationship, right? And that, there's a lot of things you need to do and to talk with your partner about consent and what you're comfortable with. And, because there's been lots of stories of people kind of filling in the blanks again to their own detriment and getting themselves into problematic situations. And we really want to try to avoid that. And so sometimes by just having very direct and uncomfortable conversations, we can prevent some really complicated legal quagmires moving forward. So that's just something, these are kind of the areas in particular that are kind of necessary to perhaps take a deeper look at, just in terms of how we view individuals on the spectrum that are a part of our lives as they age. Because, once they hit 18, they can be legally held accountable for what they do or what they say or what they think, right? And so we really want to try to provide a safe framework for them to understand how to, kind of stay out of trouble. And if we're not talking about what the rules really are, we're not really providing that as much as we could. So I don't know if any of you remember the NBC commercials, the more you know, with the little star that would go across, and they would do like a public service announcement. But truthfully, when it comes to these topics, I kind of operate from like the more you know principle, right? These conversations are difficult, whether there's a disability or not, right? And I think one of the reasons why there's so much out there that is confusing is because, we aren't necessarily comfortable with these topics ourselves. And so it's really challenging to give that talk to somebody else. But the truth is that when we don't provide the framework, individuals can fill in the blank to their own detriment. And that really is where we see the biggest challenge of, well, you didn't say I couldn't do that. And it's like, oh, okay, well, I guess I didn't know I had to say that, right? But really operating from the position of, I have to give you as much information as possible so that you understand what is safe and unsafe. That gap in the knowledge base allows other people to dictate the content, right? It's not just their friends, but it could be, you know, someone who takes advantage of them at an employment situation or someone online. Correlation does not imply causation, right? So it's this idea of me giving someone the knowledge doesn't mean that they're going to immediately start doing it, right? I always say to families, particularly when we're addressing topics related to sex education and all of this, is that, you know, it's really challenging for a lot of the individuals we work with to socially connect. So the idea that if you teach them about sex, that they're immediately going to go out and have sex is not necessarily as direct as you would think, right? It takes a lot to kind of even just make a friend. And that knowledge really ultimately is power. It's not risk. I think that the more that individuals know moving forward, the more informed they'll be as they grow into adulthood, the more they'll know in order to protect themselves and to make really informed decisions about their own lives. It can be challenging when they're young and you're kind of putting out whatever fire is in front of you at the time to then make the jump to, oh my gosh, well then what about all this stuff, right? But the truth is that, you know, we're all kind of working, those of us that work with, you know, adolescents and, you know, adults on the spectrum, we're all kind of working to play catch up along with families to provide as much information as possible and as much support as possible. You know, like I said, I do a lot of kind of consulting relating to this. A lot of the therapy that I do addresses a lot of these topics. So it's not something that where families have to just do it on their own. There's a lot of support out there for it. And I think it's really important to kind of recognize that we want everyone to, you know, be successful in their life and to have, you know, healthy feelings about themselves and healthy relationships. And, you know, that may or may not include sexual relationships if that's their choice, right? As they become adults. So I think the truth is we're trying to teach for most effective and maximization of individuals' lives in total. And that's kind of, you know, how I've shifted my focus over the years. But if anyone has any questions, I know it's a lot of information. I'm always happy to answer it. My email is here. And like I said, some of the questions might be a little bit more personal. And so you can feel free to email me instead of putting anything in a chat box. And that's it. Thank you very much.
Thanks, Allison. Did everybody get Allison's email address?
I'm here. I did get it.
Okay. All right.
Thank you.
Okay. Okay, so we're going to stop.
Debbie, I put it in the chat box as well so that people could see it.
Okay, great.
Okay.
All right. So I'm going to close your screen. Hello.
Hello. Hi. This is Dylan.
Yes. Okay. Well, I wanted everyone to meet Dylan and Christine. So we're going to have a few minutes to talk to Dylan and Christine, and then we'll take a 10-minute break, and then we'll have a presentation by Project Loss by Deputy Shirley. So, since I haven't seen you, Dylan, how have you been?
I missed you.
How's school?
I've been in the pool all day.
I saw that on Facebook. You must have a great tan by now.
He does. He really does.
Don't go too close.
Well, you're on the computer. You can.
Yeah, see, I could give you like a big hug here,
you
right?
I missed you.
I miss you too, buddy. So, are you still doing school online?
Yeah, where's Allison?
She just went. She's all done with her presentation.
Where's Janet?
She's there.
He
sees all the people's names on the side, and he wants to get to know them.
That's right. So where's Rowan?
Where's Rowan?
At home.
No. Yeah, she is. And you know what? She's doing school online too.
Miss Rowan works at the L Center.
That's right. That's right.
He just finished his distance learning meeting with his teacher and his friends at school too. So
nice.
Where do you go to school?
Exceptional Academy for Differently Able Learners.
Yes.
I like my friends.
You like your friends. Yes, you do.
And Dylan is our ambassador, right, Dylan?
Yes.
Yep. Yep.
I miss
So-
you.
I miss you too, buddy. I
I
can't
don't see
wait.
you either.
No.
I know. We're going to have to come. Hopefully, we'll get to see each other soon, okay?
Yeah.
I'll call and let you know.
You'll call her?
Yes, you can always Zoom me.
Yes.
Yeah.
We can
I
have
love
a
this,
Zoom
Debbie.
meeting.
I love Dylan.
I love Dylan. Yes. So can we get Mom to talk about the school?
Yeah.
Yeah.
The Manatee Center.
The Manatee Center? No.
Where's the
Oh,
Manatee
your
Center?
school.
Right. Exceptional Academy. Where is Exceptional Academy?
University Boulevard, number 101.
Yes, in Port St. Lucie.
Port St. Lucie.
Yeah.
Miss Debbie.
Miss Debbie.
Miss
Yeah.
Debbie's birthday's on February 24th.
Yeah. Yeah.
And
so-
how old am I?
69 years old.
I love it.
Yep. He'll tell you everything. Don't tell him your social security number.
I know. I know.
So
So, when did your school open?
January 6th, 2020.
yeah.
And we had so much fun, didn't we?
Yeah.
Yeah.
And was
We're
there a
having
fight?
summer camp.
Yes, I know.
Tuesday.
I can't wait for
Yeah.
that
You
to
want to come
start.
to summer camp?
Yes. Well,
What-
hopefully.
We
How many-
never know when Miss Debbie's going to show up.
We never know. Miss Debbie says so what.
So, how many students do you hope to have in the summer program?
We're going to keep it small because of, what's going on in the world. We have 12. We're just limiting it to 12. So that way, we can keep the kids a little bit distanced and kind of manage the hand washing and all of that a little bit better. We were hoping on having 20, but we thought 12 sounded like a good number. So yeah, so we're at capacity. We have all of
No
our,
Taylor, no Christian,
students-
no Reese, and no Sierra.
right.
And for those of you that don't know, this is the only school in St. Lucie County for children on the spectrum. So this is a great addition to our community. Right, Dylan?
Yeah. Hi, my buddy.
Yeah.
Hey,
You're,
buddy.
you're doing a great job. Thank you for being on.
You say thank you.
Thank you. Where you going?
She's going to
Well, you know what? We're going to take a little break.
Yeah.
And then we're going to have Deputy Shirley. You remember Deputy Shirley?
Where's Debbie even
right
Shirley?
here.
Hi, Debbie Shirley.
Deputy Shirley. Remember, she was at our grand opening. Remember, she was with the autism car,
Yeah, the
Yeah.
summit.
and she comes to the school sometimes to help the kids with their tracking devices too.
Yeah.
So we've seen Miss Shirley, Deputy Shirley, a lot.
Hey, buddy.
Hey,
Hey, how are you?
I am very well. How's everybody?
Very good.
Good.
Good,
So, do you want to take maybe a 10-minute break, people?
Mhm.
And then
So-
we'll come back. So what is it? So what?
About 5 of 11.
Yep.
Okay, so like 5 after 11?
Sure, sounds good. I'm
Yeah.
ready to.
Okay. All
Perfect.
right.
Thank you, guys.
Bye, Miss Debbie.
Bye,
Okay, I'll be back, okay?
Bye, everybody.
Bye, everybody. Bye,
Bye.
Miss Debbie.
Bye, buddy.
Yes,
No, I won't see you later.
you will.
Oh.
You'll see
What
Yes.
time?
later.
Just
Okay.
you and Mom can pick a time, okay?
We will. We will.
Okay.
Thanks.
Love you guys.
Love you.
Bye, Miss Debbie.
Bye, buddy. So how are you, Deputy?
I am very well. How are you?
I'm good. I'm good.
Good. Everything's been going pretty smoothly?
Yeah, thank God.
Wonderful.
I even had nightmares last night. Like I forgot to turn it on.
I can only imagine. I experience the same things when things like this are on the forefront. I always have a little bit of performance anxiety.
Well, and we're really fortunate. We have like 100 participants today.
That's amazing. That is
I know.
definitely amazing. And the coverage, some of the topics that have been fabulous. I just want to say a big thank you to Dr. Boudreau, because she touches on a lot of things that are very difficult for parents of children that aren't on the spectrum. This is really something across the board that parents should be exercising with all of their children. And there were some very delicate points that she was making, things that just simply aren't addressed in the schools, and for good reason, because a lot of parents don't want that. But then there are a lot of parents who aren't addressing them themselves, so then the child is kind of caught in the dark on a lot of issues. So anyway.
And really, as she indicated, not only for children on the spectrum, but, you're putting children at risk. I mean, seriously at risk if you're not really educating them. So
No,
at risk
absolutely.
in many ways.
Absolutely. The menagerie of safety concerns that the internet alone poses is mind-boggling. So it's parenting in the 21st century is huge. It's a challenge, definitely.
Exactly.
All right. So I don't know. Do you want to keep to the regular schedule and start at 11:15 with my presentation, or do you want me to start
Actually, I
early?
think we could probably let's see. Let me look. I see Dylan in the background.
He's having a lot of fun with this.
I know, bless his heart. I so miss him.
I can
imagine. So I think we're probably good to go. It looks like everybody's still on, so.
All right. Okay, then I will begin by saying my name is Shirley Lindstedt. I'm a deputy with St. Lucie County Sheriff's Office, and as you may or may not have read in my bio, I have been in law enforcement for 33 years. I think that this last little stint that I'm doing is probably my most enjoyable so far. I'm in contact with a lot of families that are either have family members that have Alzheimer's, dementia, or some other type of neurocognitive condition, and a lot of families with children and family members on the autism spectrum, which has really opened my eyes to so many things that I've taken for granted as a parent myself, not having to deal with or contend with. So my hat's off to everybody, because I realize it is a daily struggle for everybody. That's one of the portions that kind of segues what I do here for the agency. About 2 years ago, we had a 4-year-old autistic little girl that had eloped and unfortunately drowned in a nearby retention pond. And that started a brain wave through our agency that, listen, we are the people that people always come to first and foremost when somebody is missing. So how can we establish something or better assist those families that find themselves with family members who are prone to elope or prone to wander, and how can we maybe kind of curb that behavior for a number of reasons. First and foremost, for the safety reasons, but then there are a lot of resources that go into searches on a regular basis that maybe we can curb some of that as well. So having said that, we partnered with a company called Project Lifesaver. They are a 21-year company that has been, that was established up in Virginia. And it is basically a marriage between radio frequency tracking and humanity. We've been using it for ages in the wildlife sector of research. I'm sure everybody here has probably watched a show where there's been a wildlife show where they're tracking the range of an animal, and they'll dart an animal and then collar the animal. Well, the good news is I don't have to dart any of my clients. They pretty much come to me voluntarily, thank goodness. Not that I'm not a good shot, but I am. But anyway, moving on, it is the same type of technology. And you may ask yourself, well, how does that compare to technology like GPS? Well, we stick with radio frequency, number one, because it's a tried and true technology. And unlike GPS, it emits a constant signal, which is constantly being able to be detected with our tracking equipment. GPS, as many of you know, needs a constant signal with the satellite, and things that can interrupt that signal are things like concrete wall buildings, bridges, things of that nature. So this is something that we can track right to the device itself. In the training, one of the things that I always talk about when we were being trained on this, I had to find a lady that was banded. It was just a test subject, not an actual client, but I had to track her, and we actually tracked her to the 3rd floor of an apartment building into a shower stall. So this is very exact. It doesn't just get you proximal like some GPSs will, it gets you to the device itself. So I am definitely a firm believer, and that's why I'm a huge advocate of it. And when they asked me to take this program over for the agency, I was thrilled beyond words. So let me jump into a little bit about how this works. So if you have a family member or any caregiver that has either autistic, dementia, Alzheimer's predominantly, if you have a member of your family that is prone to wandering or elopement, then you communicate with our agency. I have provided a brochure to Debbie, and she'll be able to send that out to everybody. And we have you fill out some paperwork, and then I come out and I essentially band the individual in question. They then become part of our database, our special needs database, and should they ever go missing, they've been assigned a unique frequency that is unique just to them, and we would come out to the last known location that they were seen, and we would try to pick up that frequency. So what this is not a program where if your loved one is banded, they appear on a blip on a screen in some dark room somewhere and we know where they are at all times. That is not at all what this is. There is a lot of autonomy still. And then there is that relationship with caregivers that we rely upon them to tell us when that individual is missing. Just because they're banded, we don't know that they're missing. We simply go to where they were last seen and try to pick up the frequency that is issued to them. So that seems to be on a lot of people's minds, you know, does this interfere with my privacy and things of that nature? It does not. So once you have communicated with us and we have gotten you started on the and gotten you into the program, like I said, I come out and I band you, and just to kind of give you a little bit of an idea of what we're looking at. This is the equipment that we use. Now, these are some of the color schemes that we have available. We have other ones as well, but I find that especially with the kids, the Spider-Man and the Batman connection has made it so much easier, and they're so much more receptive to the device itself. But to give you a little bit of comparison, this is a quarter and this is about the size of the device. So it's about the size of a mid to large type watch. We can either put it on the wrist or the ankle. With a lot of my spectrum kids, especially the ones that have the sensory issues that don't like things touching their skin, most of those placements have gone onto the ankle with no problem at all. Now, they are resistant obviously at first, because when I come to the home, I'm a stranger. And in most cases with some of the kids, I've actually had to have the parents help restrain their child for me, which for those few moments sounds very traumatic. But the parents reported to me very quickly how very quickly their children adapted to it. And I mean, kids are very resilient. We've known that for many years, and there's no difference in this program. I have kids now that literally we struggled. They kicked and screamed when I first went to go band them, and now they hop up into my lap and let me do the maintenance and the battery change without any issues. So that is very heartwarming, but just to kind of an insight to let you know that this is a program that they acclimate to, and it is a program that is good, because I have had to go out and search for a couple of people. And one of my most recent searches was the gentleman had actually gotten a hold of something sharp and cut the band off. Now, I mention that because these bands, they stay on the clients. They don't come off until we come to cut them off, do the maintenance, and then we put them back on. Some people feel that that is a little bit invasive into the lives of their loved ones. But if you think about it, are you ever going to have notice that they're going to elope or they're going to wander? I mean, it would be great if they would say, hey, listen, at 5 o'clock on Saturday, I'm going to disappear, so make sure you have my band on, okay? That would be great, but unfortunately, that is not the reality of it. So we do, part of the program is that they do have to wear it all the time. They can shower with it, they can swim with it. It is water resistant, but not waterproof. So it's water resistant enough to where those types of activities aren't very detrimental to them. As I said, I come out every 60 days, and either myself or one of my coworkers, we come and we do maintenance on the band. We change the battery. They have work off of 3-volt lithium batteries, and they last roughly about 60 days. Some people get more time out of them, some people less. Right now with this pandemic situation, I'm not going out every 60 days automatically. What we are doing is we're asking the caregivers to call us once the battery dies, and then I go out and I do the maintenance on it. That just kind of reduces the ebb and flow of our contact a little bit. And what I'm finding is that some of these batteries are lasting up to 90 days. So it's actually pretty impressive, but 60 days is the norm. And we like to go by and change them. And so you'll see my smiling face every 60 days. And beyond that, it's just, I can't say enough about the program. I can't say enough about Project Lifesaver International, which is the company that provided the technology to us and continues to maintain a relationship with us as it pertains to the program. I'm happy to take any questions for anybody who has any questions. If I don't get to them here live, then Deb said she would furnish them for me and I'll answer them. But the brochure that Deb can forward to you pretty much answers most of the questions that people have. You know, how do you qualify? What do I need to do? Those types of things. And it gives you all the contact points for myself or anybody that with the agency that can put you in touch with me. Beyond that, I appreciate the time and the platform to talk about our program. It is a 2-year program. It's a pretty new program, but we have roughly 50 clients throughout the county. It is grant and donation driven, so there is no cost to the caregiver's family for the devices unless they lose certain things, and then they can purchase them to replace them. It's a good program, and I feel very strongly that it is helping because I'm noticing just in the people that we've gone and banded, when there has been a history of elopement, that seems to be getting less and less, because along with this program comes the contact with us, which we bridge then the clients with a lot of resources like FAU Card and a lot of the Alzheimer's facilities and foundations that are happy to come out and just give information and touch base with these families that need resources. It was shocking to me really how many families I'd come into contact with through this program that really knew very little about any resources out there, when there really is a very robust amount of information out there that can help them through this process, because we can't forget the caregivers in all of this. They are tasked with some very strenuous things to have to deal with and cope with. So that's really where the connection with the resources has come in very handy. But at any rate, I am very happy to answer any questions. And if you have anybody that you know that would qualify for this or could benefit from this, please do ask for the brochure and reach out to me, and we'll get you started. It's a very simple process. We've tried to keep it very user friendly because we know that you're tasked with enough as it is. So, but that's about it. That's all I have.
Shirley, one of the questions that came through was, what is the device called? And since you've implemented the program, how many clients have you tracked?
Okay, we have about 50 registered clients, and I myself have tracked 2. Our K9 unit has tracked about 3, and they have located everyone in question. A lot of times you'll see it on the news because it'll usually make the news, and thank goodness, knock on wood, it's always been good news that we have found them and recovered them. Certainly that's not indicative of the amount of wandering that we have going on, because there are a lot of people who simply are in a level of denial as to needing this type of equipment. And even though I have provided the information to probably about a dozen families so far that have not taken advantage of it, I can only guess as to why they wouldn't want something like this. But it's a personal choice, and it's voluntary, so I can't sit in judgment of it. I just hope that somewhere down the line it doesn't turn out badly.
Well, and I'm hopeful too that through things like this, that the Autism Summit as well as the Child Summit, that we can get even more information out into the community, for people to take advantage of this. And I have a question.
Okay.
My grandson's a police officer. He's very interested in K9. So how does the K9 track the signal?
Well, actually, it's the handler.
Oh, okay. I'm
handler.
like, man, that's really cool.
Well, when this first started several years ago, actually, our K9 unit partnered with Alzheimer's Community Care, which is a local resource for the Alzheimer's platform. And they also provide tracking devices, but law enforcement is the entity that has to search for them. So they had our canine unit, they got our canine unit involved. So all of our canine unit at that time was trained with their tracking equipment. Well, this is actually a different tracking equipment that our program uses, but we still support the Alzheimer's community care and track for them should any of their clients go missing. But ours is actually a different, and there are some variations, but it's the same concept, radio frequency tracking, and that's the only reason why our canines were doing it.
Okay.
But our canine dogs can track people. They're just not tracking it with technology. They're tracking off of scent. So they could also track, and they're obviously very good at what they do as well.
Right. And somebody asked, what is, does the device have a name?
It is just Project Lifesaver. That is the name of the all of the material. It's the company that actually put the two together and has been using it like this for the last 21 years. Our program is called Project LOSS, which is an acronym for Locating Our Survivors Timely, and that was just something so that we could name it something for funding and all those other things. But it is just a transmitter band. It's our banding program. So if anybody needs to refer to it, they can refer to that, just simply calling it that, and they'll know exactly who to put them in touch with.
And then I had another question that, is it available in other counties? Or do you know?
It is actually, now the way our program works here, we are the only county on the Treasure Coast, and by that I mean Okeechobee, Indian River, Martin, and our county. We are the only county that actually does this. Port St. Lucie Police Department and the St. Lucie County Sheriff's Office actually have this program where we're the ones who are facilitating it. However, Okeechobee is getting on board as far as being able to track. I know Indian River is already on board. Martin County is already on board as well. So they do have the equipment to track. They just don't facilitate going out and banding and maintaining this program the way we do. Hopefully moving forward, they will jump on board. But obviously, if they're just tracking, that's still helpful in all of this. My program in and of itself only applies to St. Lucie County residents. So you have to be a St. Lucie County resident to qualify to receive a band. But should you get your own band, if you live in a different county and you contact Project Lifesaver and you get your own band, we would still be the ones tracking you, and the agencies that you live in that jurisdiction would still be tracking that individual.
Wow,
so.
that's great. That's
Now,
really
something also worth mentioning, because I tell it to all of my clients, is Project Lifesaver is actually in agencies throughout the country. Roughly 1,600 participating agencies throughout the United States are able to track this equipment. So when they do get banded with me, part of my routine that I go over with them is I give them the website. I help them to load the website onto their smartphones because no matter where you are in the country, you can go onto that website, input the zip code, and it'll pop up all of the participating agencies, and then you can select a radius of 50 miles, 25 miles, 100 miles, and it'll give you the phone numbers and contact numbers to all the agencies that are participating in the Project Lifesaver program. So it's actually a huge benefit, especially if you're traveling.
Oh my gosh, that's amazing. So do you have an idea of maybe what a band would cost? So say you're...
Yeah, we pay $325 for the transmitter, the case, and a year's worth of batteries and bands. So that is the cost that we pay with our grant monies to get one device. And the tracking equipment obviously is separate, but that's a price that the agency incurs, and the caregivers don't have to worry about anything like that. But the transmitters themselves cost $325 each time that we band.
Really? I mean, that's... it's a lot more affordable than what I thought it might be. So that's awesome. So I don't know, does anybody else have questions? You can send them to me through chat. Question was, I wonder if Medicaid or insurance would cover that cost.
That I don't know, but it certainly would be worth asking your insurance companies.
Right.
I'm not sure or not, but I will tell you that I'm having taken over the program. Not only am I the coordinator of it, but I'm also the fundraiser individual for it. So I have on our website, TennessseeCountySheriff.com, there is the opportunity to donate. I also write grants. We just got a $5,000 grant from the Alzheimer's Association of America, which I was able to buy several transmitters with. So that is part of what I do as well. And because I'm doing all of it, I'm a master of none, but a jack of all the trades. So as the monies are coming in, I'm reinvesting it into the program and purchasing transmitters, because that's really the only overhead that we have is the transmitters themselves and the search equipment. The sheriff pays for everything else, my salary and everything like that, the sheriff covers. But anybody who is interested in any type of fundraising or has any fundraising ideas that they would like to share with me, I'm going to be putting in my email address and the website to the sheriff's office. Actually, I'm sending that out in message to everyone right now. Please do reach out to me, because I would love to have a little bit of assistance with this, because it's catching on, and we're getting more and more people every day. In fact, I'm going to be banding a new client today after I finish up with this Zoom. And I think it's something that ultimately right now we're trying to focus on individuals, because we don't have a lot of devices. We're trying to focus on individuals that have had a history of elopement. But ultimately, I would like to get everybody that could qualify for one having a band, because you never know when it's going to happen. Especially with the neurocognitive issues like Alzheimer's, they may not wander in the beginning of their diagnoses, because they're still pretty cognitive, and it's a degenerative issue. But you never know when it's going to happen. You never know when that moment has come where now they're either looking for you or looking for their loved one, because they don't see him. They don't know they're in the washroom doing dishes or something like that. So they go out the front door looking for them, and before you know it, they're lost. So ultimately, my goal is to get anybody who has the condition banded if they would like to be banded. But right now we're having to prioritize, because of funds, prioritize people who have already eloped or are starting to show that behavior of elopement. They're trying to get out of locked doors and things like that. So,
well,
anyway,
you and I should get together. I'm happy to share my resources, my funding resources with you.
Awesome.
So yeah, I've been digging for money for a lot of years. So, thank you so much. Yeah, thanks so much, Shirley. We really appreciate you presenting.
And thank you for the invite. I've enjoyed it. It's been fun.
You're
this is
welcome.
my first Zoom.
Yeah,
well,
hey, this is my first big one. And somebody asked me if I was in the bathroom. I'm not in the bathroom, just so you know. It's the cabana.
I'm in my car, so my barking dogs wouldn't constantly interrupt it.
Oh, I know. I said earlier, I'm just happy the mowers came yesterday.
Oh, yes.
Yeah. So, well, thank you so much. And our next person to present is Patrick. Are you ready, Patty? Let me find you and I will.
Hold on just a moment here.
Here he comes. And as I mentioned, Patty is an accomplished journalist who has offered to, actually he connected Christine and I, and also gave me lots of insights into autism. And he has offered to answer any kind of questions that you may have. Let me find you, Patty. Are you gonna be on screen, or you just want to show your?
Yeah. Okay. Hi. I will let people get a look at me for a moment.
Okay.
I don't promise it'll last very long.
That's okay, Patty.
If I can figure out how to, oh, there.
There you go.
Well, I'm not seing me, but
I don't see you either, Patty. What's up with that? Did you click your video camera?
I did.
Are you hiding?
Well, where I live is very low on bandwidth, so it
Oh, maybe that's it.
might be. Let's. Well,
So do you want to
okay.
tell people a little bit about yourself? That I think.
Oh, wait a second! I just figured out what's going on here.
Look at you, Patty. All right. So did you see Dylan?
I did. I did. Hello, Dylan. Hello, Christine.
And as I said, that's how I connected with Christine and Dylan, was through Patty. So we lost your visual again, Patty.
Well, no, I turned it off.
Okay, that's fine.
I could only do it for so long. I could only do it for so long. But I
And
did.
I have to say that Patty did say, when I asked him, actually he offered to participate in the summit. And I said, told him we were going to do it by, via Zoom. And he said, "Oh, welcome to my world. I like the format."
I've worked at home for most of my adult life. It is just, I much prefer it. I cannot stand offices. I don't even go into grocery stores. I have my groceries delivered to me. And I'm seeing people on Facebook complaining about the socially distanced world, and I'm like, well, welcome to my world. This is how I live on day in, day out, and I enjoy it. Now, I do know that not all autists are like that. I know that some need routines that they do that involve being in and around other people and what have you. But I am among the autists that I hate the suffering, I hate the death, I hate the fact that people are being financially ruined, but I kind of like this world the way it is right now.
I was wondering too, people, anybody that has, I just got a comment. Somebody said they agree with you, Patty.
And
Actually, I think my husband agrees with you too. He's really not much of a, he doesn't like a lot of crowds.
by the way, my nickname Patty has 2 syllables, folks. I do see in the comments that some people didn't quite catch that, but it's 2 syllables, Patty with 2 D's. So if you message me, please be respectful to that as my name preference. And digressing for a moment, I have, it doesn't sound like it right now, but I'm actually an accomplished public speaker and columnist as well. And when I speak on the topic of autism, I like to remind folks that I was an autistic 13-year-old. That was 40 years ago that I was an autistic 13-year-old. A decade later, I was an autistic 23-year-old. Before I knew it, I was an autistic 33-year-old. And now here I am, 20 years later, an autistic 53-year-old. I've done several life phases with autism accompanying me every step of the way. So that's why I wanted to be here today. How can I help you? What questions do you have that you would like to ask an autist? And I promise I will take any question and I will give you an honest answer. So as I understand this, people can use the comment to pass a question directly to me if they like. Debbie?
Yep. So I don't see any questions yet. So please be sure and send us some. I do have a friend who her daughter is on the spectrum and was very nervous about taking her driving test because she had to be in the car with somebody that she didn't know. So maybe could you talk about something like that? I mean, these common things that are, well, not common, but life challenges for someone who's on the spectrum, like the
Oh,
driving test.
wow. Where do I start? With driving, I can seem very hard, fast, and rigid. My thing is, if an individual cannot feel comfortable that she or he will drive with 100% competence 100% of the time that they are on the road, it's time to look for transportation alternatives. And I know that sounds very hard and rigid, but the reason for my position is this: other people's safety takes precedence over all else, in my estimation. As an avid cyclist since the 1980s, I have actually lost count at the number of people who have, in some way, shape, or form, connected their vehicles to me, hit me in some way, shape, or form.
Mm.
And the worst happened in March of 2015. I was training for a what's called a Century. It's a 100-mile bike ride that was benefiting a Gold Star Families Foundation. And a driver on a mobile telephone did not see me literally right in front of her at an intersection and ran me over. It's amazing that I got out of the crash with as few injuries as I did. There are a lot. Yeah.
Okay, so I'm starting to get some questions now. So one
Good.
is, would you feel comfortable explaining what you feel other people do not understand about you?
That is a terrific question, and we could be here for the next week with me answering that. But it gives me an opportunity to talk about something that was brought up earlier today, and I'm not remembering the first speaker's name right now. But
Kelly?
Kelly, thank you.
Yeah.
She briefly touched on the topic of sensory issues. And I jotted down a note here in case nobody asked me a question to talk about this. I want to emphasize, believe and respect people's sensory claims. Whether you know the individual to be autistic or not, when people make sensory claims, believe and respect them. When I was in school, I had teachers pull me aside probably dozens of times to tell me that I could be doing so much better than I was. And at some point, those teachers always asked me why I wasn't doing better in their classes than I was. And I would tell them that their classrooms were cacophonous, that they were loud, that they were distracting. And the teachers would tell me that their classrooms were fine and ask me what was the matter. So at that point, I had just been told the problem is not a problem. And I pretty quickly learned to just shut up about it and to deal with what to me were very loud and cacophonous classrooms. When I got older, high school and then into the workplace, class and workmates dismissed my explanation that touches to me feel like electric shocks. They hurt. If you walk up to me and touch me, it feels like an electric shock, and it's actually physically painful. I would tell them that, and they would continue to touch me and got offended when I started slapping their hands away. And so When I was in school, I'd end up in the principal's office. When I was in the workplace, I would end up in H&R, HR
Right.
offices about creating creating a hostile workplace because I was slapping people's hands away. When
Okay,
people,
so there's two more questions that came in. One is, my 16-year-old grandson is here and would like to know how you found out you were autistic and how you coped with your teenage years.
the way I found out was the worst possible way. When I was growing up in the 1970s, very little was known about or understood about autism. And so the diagnoses I got was learning disabled without any specificity to it. In other words, they were saying, we know something's wrong, we just don't know what it is. And so I got minimal services in school. By the time I got to junior high, what services I got, they were gone. And I did not do well in school. I ended up getting a GED, even though intellectually I should have done much better than I did. As a young adult, I was living in a world that was much more stressful on me than it should have been because I did not understand that I had sensory issues. I thought everybody perceived light and sound and touch the same way I did. I didn't understand that I was different. And so I was living in an extraordinarily stressful world, and it induced self-injurious behaviors. To tell you how honest I can be, I was the head hitter. I was the person who would get into the sensory overload and start striking my own head. That got me into an emergency room. That emergency room got me into a psychiatrist's office. And the psychiatrist, after numerous interviews and tests, gave me one test that asked me to rate myself against, and I quote, most other people. You know, this 1 to 5, agree, disagree, against most other people. And so I sat in that psychiatrist's office arguing with him that I could not rate myself against most other people because at that time there were about 6.5 billion people on the planet. I had met at most 10,000. And of those 10,000, I had spent very little time with the vast majority of them. So I had no idea what most other people do. I think that's the moment at which he thought, yep, Asperger syndrome, no doubt about it. And it was in 1993. So that was the diagnoses I got. I went to the library because we didn't have the internet yet. And I looked up articles on Asperger syndrome, did not like a single thing I was reading, and basically tore up the diagnoses and never told anybody for 20 years.
Wow.
That's how I found out.
And also, too, to those of you that are in the audience, Patty is also a child of the child welfare system. So and I know that there are a number of you on this Zoom call. So really what Patty's saying, you know, speaks to the importance of, you know, the intervention and being able to provide the services and support children need if they're on the spectrum. And as I mentioned earlier, I'm very fortunate. My grandson would be considered Asperger's, and he actually sees Dr. Kelly. And it has been amazing, the progress that he has made. And I was telling Patty in a recent call, I had said to my grandson, you know, what do you want to be when you grow up? And he told me a biomed, gosh, I can't even remember what it was. A biomed, well, first he said he wanted to be a robotics engineer, and then he wanted to be a biomed engineer or something. So I was like, I don't even know what that is. And he said to me, Oh, Nana, you know how doctors work with people with prosthesis? Well, oh, biomed vet. So he said it's vets who work with animals that need prosthesis. Now, I was way off my chart. So, and as Kelly said, and Allison too, I mean, these children are so passionate about the things that they're interested in. Okay, so I've got two more questions, Patty. One
I, I,
is,
I saw that, and before I answer the first one here about
okay,
my journalism, I do want to state that by the time I was in late 20s, early 30s, by then I had gotten control over the sensory overload. I had learned meditative techniques in a spiritual venture of mine, and I was able to use those meditative techniques to bring the sensory stress under control. So while that wasn't a clinical intervention, it was unintendedly so. It did turn out to be an intervention that worked very well for me. Someone had asked what kind of reporting I do. I've been a reporter for 25 years. Some of you might be thinking, wait a second, didn't you say you had a GED? And yes, I do. I was working a night job that gave me a lot of peace and quiet, and it gave me an opportunity to think about my life and what I wanted to do with it. And I decided I loved reading newspapers, so I wanted to be a newspaper writer. And I started reading the Orlando Sentinel and Daytona Beach News Journal cover to cover every single day, pretty much every single story, learning how news stories were written, learning how they flowed, noticing that they all did certain things the same way and discovering that was called AP style. And then I went to the editor of a community newspaper, and I told her I wanted to be a writer. And she said, okay, well, show me what you can do. And she was impressed with what I had taught myself, and she apprenticed me from there. We did unfortunately later have a falling out, but I will always appreciate what Barb did for me. And I, autism comes with disadvantages, to be sure, but it also comes with advantages. I believe it was my autistic brain that allowed me to read stories to dissect how a news story worked. So I've been in journalism for 25 years now, and in general, I'm what they call a general assignment reporter, meaning I've covered a wide range of topics over those years. My favorite topic is Veterans Affairs, and I do write for a veterans interest newspaper here in Florida called Veteran Voice. That's my favorite, and my second favorite is religion affairs, writing about religion in general. I hope that answered the person's question about my journalism career.
I think so. And there is another comment too from the woman says, my grandson said thank you. He also wanted you to know that he doesn't tell others that he is autistic, but if they figure it out, he will not deny it. So I'm glad that he was able to hear Patty talk.
I in 2013, I was at the early romantic stage with a friend. You know, she and I were going through that transition from the friendship to the romance, and we were walking, and she said, you know, you remind me of these children that I was trained to take care of. She was a professional nanny, and just tell me about these children. Well, they were autistic. So she's talking about the specialized training she had to go through as a nanny to work with this family that had 2 autistic children. And she got to the end of it, and I said, "Well, let me tell you why I might remind you of them." And and uh, she um, she did the research that I had not done, and she discovered Temple Grayton among other good writers. And I uh, read more up to date books about Asperger's and autism, and I realized that the darker ages of misunderstanding were past, and that's so I came out in 2013. Like the grandson, by the way, very rarely do I tell people that I am autistic. If I have to ask for an accommodation, I like using the phrase autism related. So, for example, if if I'm going by a restaurant for a pickup order, because I never eat in restaurants, I might go in, my food's not ready, it's very loud in there, and I might tell the waitress, "I have autism related sound sensitivities. Can you please run it out to my car when it's done?" Um, because I have noticed that if I just say I'm autistic, then I have to hear about everybody's neighbor's kid or or nephew, and along with that, I get to hear all their misnomers, and I don't want to. So
Right.
I rarely say I'm autistic. If I have to say something to ask for an accommodation, I prefer using the phrase autism related, and then state what that issue is.
I like
Um,
that.
it,
And we have another question too. What book or books or authors do you recommend regarding autism?
um, I, I I have mostly read Temple Grayton, and I do know that she is controversial in some portions of the autism community. There are some people who think that well, the phrase that they like to use for her is ableist, which I disagree with that. I like how she has an approach to autism that says autists, and yes, that is a noun, you can look it up. She has an approach that says autists are generally speaking much tougher cookies than you might give them credit for. And I believe my own story helps is anecdotal evidence of that. I was growing up without a diagnosis, and I was having to deal with a world that not only wasn't aware that I was autistic, but even if they were aware that I was autistic at that time, they probably didn't know what to do about it.
So
And
what's the last name, Patty?
Grayton, Gradin, I believe it is.
Okay.
She is an animal scientist, and arguably the world's most famous autist right now.
Nice.
And yes, she does have she has a very, I don't know the right verb here, or she expects a lot of people, uh, autists and neurotypicals alike. She has a very um, she expects a lot of people, and I believe rightly so. Um, because as one of the things one of the things I run into uh, is, well, I'm going to digress for a moment. One of the events that I've covered repeatedly as a journalist is the National Veterans Wheelchair Games. Every year, about 500 to 600 wheelchair using veterans get together in different cities, and they participate in various athletics. And the wheelchair games have helped to produce Paralympians. One of my friends, Patrick McDonald, he is a spinal cord injured Army veteran who has been to 3 Winter Olympics now that I know of, and he started at the wheelchair games. One of the statements that floats around the wheelchair games is that man or woman isn't disabled except for the spouse. You know, you can very often tell who what they call new injures are because their spouses are still scared to watch or let them participate in things like wheelchair basketball, which if you've ever seen a wheelchair basketball game, you would understand why it scares the spouse.
Right.
But if you play wheelchair basketball, you are falling out of your wheelchair. That's just how it goes. I have kind of the same mindset with a lot of autists that most often autism becomes a disability, not because of the autist, but because of the people around her or him. Autists don't need, we're much tougher cookies than a lot of people seem to think.
So, well, Patty, I really appreciate you participating in this. I want to be sure that, do we have any more questions out there for Patty about anything? As he said, he's happy to answer anything. How uncomfortable it might be for you, it's not uncomfortable for him.
If they don't start asking questions, I'm going to start talking about 1980s vintage road bikes, and y'all will just
Yeah,
be here
right.
for y'all will be here for the next 6 hours hearing about my bicycles. You better ask questions.
Well, I just got a thing. My grandson agrees with Patty, and I got an LOL. Oh, and somebody just said my husband would love that, you talking about bikes. And everybody is so appreciative. So, any more questions? Okay, is this the controversy of Autism Speaks? I was surprised to find out that my teen is offended by the group, and I don't understand why exactly. Can you explain?
I have never done a deep dive study on all of the allegations that are made, but
Okay.
the synopsis of the criticism that you will find in autism groups on social media is that, number one, they claim that none of the board members are autistic themselves, which, if that is true, and I don't know that it is, but if it is true, yes, I do think that that's a problem that they need to remedy. I am a very big believer that if you are going to have any program, any organization, anything that is for people with autism, then you do need to include people with autism in the highest levels at your earliest possible convenience. Now, I do understand that sometimes when you start a new program, you may not know any adults with autism, but with time you'll discover some. And I am a big believer that if you're going to do anything for people with autism, you do need to include people with autism. The other claim about, well, there's a few claims about Autism Speaks that when I've glanced over its website, I have not found supportive evidence for that. So I am not speaking in favor of the group, but I am not speaking in opposition of it either. But yes, do be aware that there are criticisms about Autism Speaks, and every individual needs to do the degree of research they need to satisfy their own minds about it one way or the other.
Well, and there was a comment too for you, Patty, that says, I just think it's awesome that you have learned what works for you throughout life.
Thank you.
Do we have any more questions for Patty? Or is everybody getting hungry for lunch? Oh.
How can someone get prepared
Here
Here
we
they
go.
come.
It
Um,
says, you might be a great board member candidate. And thank you, Patty. You give parents of children with autism. Wait, we're
I want to
okay.
catch this one real fast, please.
Okay.
Someone said, how can someone get prepared to live on their own with autism? And I am going to go back to what I said a moment ago. Us autists, we are much, much tougher than I think a lot of people assume or believe. I'm going to say something, and believe me, this is not bragging when I say this. I just want to illustrate the point of what I'm saying. When I was working from 8 a.m. till 4 a.m., I was walking home one morning and not paying the attention like I should have been, and somebody walked up to me and stuck a gun in my face. And about a second later, he didn't have that gun anymore. And a second after that, he was on the ground. I'm not saying that to brag on myself. What I'm saying is, if you were to just ask 100 people um, how someone with autism would respond to a situation like that, I am guessing, and I don't have evidence for this, but I am guessing the majority would think that the response would be much more constrained, would be a very intimidated response. My response was just natural. That's just, that was just me. And I think it's illustrative that people with autism are, in my opinion, no less tough than anybody else out there.
Right.
And never underestimate us. And for those who are fellow autists, never underestimate yourself.
Good. So thank you, Patty. You give parents of children with autism so much hope for the future. And let's see, there was another one. My grandson said that most peers usually bully him. Hang on.
Yeah, bullying
He
is
seeks out individuals that treat him as their, whoa, I'm getting all kinds of stuff here now.
I'm
Hello.
going to pick up.
Okay.
Treat them as their equal, but that is very hard during the teen years. Nobody likes their teen years. I have yet to meet anybody who ever liked their teen years, and it's awkward and strange for all of us. And that's the most important thing for teenage autists to know. It's not just you.
Right.
And bullying is a whole other dynamic that takes its own conference. So I don't even want to try to start on that topic. Someone thank me for my willingness and openness. You're welcome. Wait a second. And they threw in, I love my vintage Bianchi and Panarella. Yes, and I've got a 1987 Bianchi. So we're fellow Celeste riders. You don't want to hear about the other 16 bikes, but I will, for this person, throw in this real fast. I have a 1985 Trek 2000. And if you don't know what that is, just go online and search 1985 Trek 2000, and then you can be envious of me for the rest of the
day. Okay, so we have, I think your presence here and accomplishments speak volumes in comfort to a lot of parents' concerns about the future of their children who live with ASD. So thank you for that. What advice, if any, would you give to young children on the spectrum?
I'm going to give the advice to the parents because they're the ones who are listening. there are a few things that are repeated themes for me in discussions with parents on Facebook groups mostly. One of the things I caution parents, and I'm speaking as a parent and as an autist when I say this, but one of the things I caution parents about is don't be too fast to attribute behaviors to autism. Take, for example, if you had a 4-year-old who refused to clean his room, to automatically leap to autism as being the causative factor is misguided. Almost no 4-year-old willingly cleans her or his room.
Right.
So before you rush to attributing behaviors to the autism, and especially before you go to attributing behaviors to autism to the child, first go through a sort of mental checklist. Is this age appropriate? Is this a behavior that is common to the age? Is my child getting enough sleep? Is my child eating a reasonable diet and not tons of sugar? In other words, look for what could also be explanations for the behavior. And after you have gone through those, if what remains is autism, then it becomes a reasonable hypothesis. But I have talked to parents, and I've also talked to yet now young adult autists on this topic. When you attribute everything to the autism, it contributes to the sense of weirdness, I believe. It can create a cycle of attributing everything bad or everything different to the fact that the child is autistic. Autism has distinct behavioral and attitudinal manifestations that are common and predictable. But when people start to attribute all kinds of everything else to the autism, I believe it creates a sense of weirdness for the child. So that's the advice I give is to the parents and to the autists alike. Don't be so fast to attribute everything to the autism. Look for the other reasons as well, because you're a
Thank you.
complex. You know, autism is complex, but you know what? Human beings are complex too,
Yes.
and we are
Well,
still human.
I know. Patty, again, I want to thank you so much for offering to participate in this and to answer so many questions. And I want to just let people know that if you were late kind of checking in, we will be sending you a link to the entire recording of today. And I'm kind of happy. I think we did much better than I had anticipated. I was having nightmares last night on what I was going to forget. So we also are going to be sending you an evaluation form that you need to complete if you want CEUs or if you need a certificate. And, you know, again, we're very grateful to all of the people that presented today, as well as Sandy Pines, for providing the CEUs. And again, I'm very grateful to Patty and also to Dylan and his mom. So if you think that this went well, what we may, Guardians for New Futures may try to do some more of these this year, since I know that so many professionals need their CEUs. So, you know, feel free to email me. But like I said, I'll send out the PDF that Deputy Shirley talked about, I will send you the presentations from Dr. Kelly and Dr. Allison, and again, the evaluations. So I hope you all have a wonderful day. And it was good to see you, my buddy, Dylan.
Hey, Miss
Say
Debbie.
thank you.
Bye, Miss Debbie.
Bye, I love you, buddy.
I'm gonna say hi to Miss Debbie. Miss Debbie, what are you doing today?
Dylan, she's going. Everybody's
You know
going.
what?
Debbie,
I'm
what do
gonna go to lunch because I'm hungry.
What are you having for lunch?
I don't know. Maybe a burger.
Thank you.
I missed you.
Okay.
I miss you too, buddy. We're gonna see each other soon. And I'm so glad that Patty connected you and me and your mom.
Absolutely.
Yeah.
Right? Thank you, Patty.
Bye,
Absolutely.
guys.
Oh, I put my email address on there for anybody that wants to email me any questions. Okay.
Yes.
Perfect.
Thank you, Patty. Thanks everybody for participating.
Thank you, buddy.
Thank
Have a
you.
Bye,
great
Miss
day.
Debbie.
Bye, buddy.
I'll catch you later.
Okay. On the flip side.
I'll see you later.
All right. Bye, buddy.